because मैं बोलूँगी नहीं इनके बारे में, ये खुद ही बताएंगे कि ये क्या क्या करते हैं. And of course, Dr. Sumer, who is the man behind this entire program today, the one who wants USMLE in a big way in India for all of you. So just put your hands together, all of you, and let's start. Welcome, Dr. Rit.
Good morning. You guys can hear me. मैं वैसे उच्चा ही बोलता हूँ. ओह क्या हालत है. So what I'm trying to do in next two and a half hours, this presentation is for Indian students. Like every country has their own challenges in medical education. It's a little bit different, right? So if you are in US, your schooling is different. Here schooling is different. So what I'm trying to do is I'm trying to connect all these dots today, so it will become easier for you guys. I just want to tell you a little bit about my story and how me and Dr. Srinivasan is connected. So it was very interesting when I got a phone call and we were talking, and my wife was sitting with me, and so I'm talking to, I said, Dr. Srinivasan, good morning. So she's listening, and after our conversation, so she asked me, is it Dr. Mala Srinivasan? I said, yes. She said, do you remember when we started USMLE preparation, 1999. So the reason me and her, we are in US, is her. So in 1999, Dr. Srinivasan actually started Kaplan in India. That was the first batch. And she did it, step 1 and step 2, both. So it worked out. So she is right now director of Hemong Fellowship in New York, and me, you guys know. So thank you, Dr. Sab. So then I thought, it's good. The start is good, right? So we should do it. And then I went through, some of the work, Dr. Sumer is doing with dams, and I was looking for something for step preparation, because that's where that is not my specialty and I don't have time for it, right? A lot of students ask me this, like, can you help with step 1, step 2? I tried with different students, with different organizations, never worked. But when I saw Dr. Sethi doing this amazing work with NEET and FMGE, so one thing I came to my mind is, so basic is same, right? Anatomy is same, physiology is same, medicine is same, surgery is same. The way they ask you question is different, right? So if they can prepare you for NEET and FMG, I think USMLE will be very easy. So that is the whole idea of today's presentation. How we can collaborate, Brooklyn, USC and DAMS, starting from step all the way up to the match and further. Fellowships and, so these are the guys who matched, worked with her, they're here. They will also tell you guys their experience. And I know there are a lot of students online. So Dr. Sethi has the chat. If all of you, any of you have questions, please keep typing the questions. We will try to entertain those questions in this. So rotations part, you guys know we do, right? I just want Dr. Sethi to come with me for just 5 minutes, tell his experience in NEET and FMG and how we're going to transition that part. But we have a lot of programs coming up where we are trying to help you guys. I understand USMLE is always scary, right? That uncertainty, what will happen to me? So some students ask, like, what if this doesn't work? So can we create some programs, NEET USMLE, FMGE USMLE, so that not only you guys are preparing for USMLE, you guys also can prepare for NEET and FMGE exams, right? And with these both things together, as I said, fundamental is same, study is same, it's just questions are different. So Doctor, please, if you can. Just tell us a little bit about dams, how, they all know, but.
Anji. So thank you, Dr. Ratesh, for the excellent start to the event. And Before I start, how many of you you've given your steps, or how many of you are planning to give the steps? Planning to give the steps, है ना? Given the steps. All of you have given the steps, or anybody who's planning to give now? Planning to give now. Okay. अच्छा, एक बात बताओ, मतलब how do you look at US? क्या चाहते हो, मतलब what is it that you want out of USMLE? Okay. Let अगर मैं दोबारा से बताता हूँ, I'll give you the idea and I'll give you the idea about the teaching and what we are doing. So what I look at any exam in India as is it's an opportunity. So why do we write NEET PG? It's an opportunity to study further. Why do we apply for a visa to a country? It's an opportunity to keep the doors open. You may go, you may not go. And the idea that I wanted to share with you today is that even if you're half-minded about USMLE today, you should be thinking in a way that if I appear for a licensing exam of a country and I pass, it keeps the door open for me. I may go there for residency, I may go there for a fellowship, I may not go there also, it is okay. But I'm keeping the door open. So suppose you get a 10-year visa to America. You may go, you may not go. But nobody can stop you, the door is open. So any exam is a door opening to a opportunity. So what is the difference between NEET PG and USMLE exam, and what is my experience in teaching? My experience in teaching is that when I started this academy around a quarter of a century back, around 25 years back, we started with a thought that people need to be told about opportunities beyond MBBS. At that time, everybody was thinking if I do MBBS, it is good enough. But people who were studying beyond were making good things for themselves. So we thought, why don't you study further? He said, "Nee, boss, there is a competitive exam. How do we tackle the competitive exam? It looks tough." So we started guiding students in Delhi a quarter of century back for their competitive exam. That time it was called as All India PG exam. The first batch who joined us in a building nearby, there was a small building nearby. They joined us. We had a batch of around 40 students. Out of those 40 students, each one of them matched into PG, and suddenly the name started to spread. And people said that because we are sitting in Delhi, we should call it Delhi Academy of Medical Sciences. That is how it started. And then the students from nearby cities started to travel to Delhi to attend our classes. Some students would come from Chandigarh, some would come from Rohtak. I remember a group of students who would take a Innova at that time to come from Meerut to Delhi every time. And they started to attend the DAMS classes. And we thought that this is how we should be doing, and we continued teaching students face to face in Delhi center only, and we are called as Delhi Academy of Medical Sciences. Gradually we saw that other city people started to come to me. I had no idea about business, I had no idea what is business, I had no idea how to go about things, and they started to come to me. What do you can we open your center in our city? I said, why would you open my center in your city? He said, sir, have you thought about franchising? I started franchising, I started opening centers my own self also, and we grew to become a largest academy across India. Today the southernmost center of dams is in Cochin, and in the north we have center in like straight at Chandigarh. Then in the west we are in the Ahmedabad, Baroda, and in the east we are up to Kolkata and Guwahati. Yes, all could happen because we make sense to students that what we are telling is how the exams are going to be. So I want to bring the same credibility to USMLE with this partnership, that if we say something, we want to be doing it. And USMLE is an opportunity that many graduates in India are missing out, because they think if I give exam, I will have to settle in America. I don't know if I would want to do or not. And everybody is unsure. But the idea is to keep the gate open. If you keep the gate open, you can go anytime. You may need to go, you may not need to go, but the idea is if you don't keep the gate open, you will never be able to go. It is like a visa. Licensing exam is like a visa. Visa is for normal citizens. Licensing exams for doctors. Visa will help you to get there. License will help you to practice as a doctor. In America, they will also test you on language. Their exam structure is very different from our structure. Their exam would be in blocks. Questions will be long stem. And the major idea will be to find what is being asked in that stem of the question. Let me give you an example. Which part do you think you will find more tough? Step 1, step 2 CK. Step 1. Step 1. When you give the step 1, in India we are all used to a certain style of questions, 2 line, 3 line. And basic sciences are very factual in India, that which muscle is attached to this tuberosity. Finish. But now in USMLE, the questions will be hidden in a blanket of clinical history given to you. I'll give you an example, and then I'll hand over the mic back to Dr. Radesh. I'll give you an example here, that suppose they give you a question. A patient had a high-speed motor vehicle accident. Following the accident, he was confused for some time. Why would you be confused for after accident? That is called a concussion. Because of the high velocity accident, you suddenly lose your consciousness and you become confused, you're dazed. Concussion. Then he gave his statement to the police that this is what has happened. After that, he was again unconscious. A CT scan of his head was advised as a part of evaluation. That CT scan is shown as an image in the question. Are you able to? On that CT scan, you can see a brain CT with a biconvex hematoma in the skull. So far, it looks like a clinical question. And then they go on to say, the pathology which is shown to you on the CT scan is caused by a rupture of a blood vessel. That blood vessel enters the skull through which of the following foramens? So it looks like a clinical question, but they go back to anatomy and the answer is foramen spinosum, because the middle meningeal artery enters through the foramen spinosum. Second question, they show you a CT scan of the brain. They put a star marked at the amygdala. As a physiology question, say look at the brain and they put 1, 2, 3, 4, 5, 6 at different parts of the brain. It's a CT image, but the anatomy is shown with numbers on a CT image. Step 1, students appearing for basic sciences are not aware of CT anatomy. But in America, they want more clinically oriented anatomy. They want that if you are getting anatomy, you should know how to apply it in clinics. And the question stem will say, it will talk about emotions and fear, and you would have to locate which number represents amygdala. Classic step 1 question. So USMLE step 1 is like a clinical blanket, but going back to basic sciences, which is what our students are not used to. And second problem with our students is, when they see our exam outcome as pass and fail, we become overconfident. We like, अरे पास ही तो होना है, पास तो we have every हम तो हो ही जाते 33% आते स्कूल में कर लेते पास. But in real life, it is not so easy. It's not so easy. It is very important that we pass our step 1 in first attempt, and the step 1 will be the place where you will need maximum help. Followed by step 2 CK, because you want a high score. Because if there is no score in step 1, what will be the differentiator? The second differentiator will be your score in your step 2 CK. And the third will be, it's a major difference between India and US is, India, we are a large population heavy country. So we are very competitive about everything. So if there is so much competition about everything, the only way the government can keep the exam system fair is by keeping it as a single exam, no interview, no well-rounded individual. Like suppose you, if I introduce a system in India and I tell you that you bring your research papers and we'll give you marks for it. I'm telling you, everybody sitting in the room will have 100+ research papers, and you will make the Nobel laureates go to shame. You agree? So India, they cannot do this. India, we cannot seek well-rounded individuals, because there is a number of people appearing for the exam is so high, and our mindset is like this, that we are all used to a certain kind of behavior, that if it is going to give me marks by hook or crook, I will create it. But that is not how America works. In America, they are seeking well-rounded, genuine individuals. So they check your academic excellence with step 1, which I talked about, and step 2 CK, and they see the score in your clinical sciences. Is that fair? Then they see the well-rounded with the US clinical experience, where Dr. Radesh would come into picture, that they will check your experience in their system. And I'll tell you the most important secret to a rotation. Before I conclude my session today, I'll ask you, why do you want to do a rotation in America? Why do you want to visit America before you join a residency? It adds to your resume, I understand that. Any other thing? It is like flirting with each other. They see you, but you also see them. I have seen my students in the past who have gone to America for a rotation, come back and said, "Sir, मेरे को ये culture ही जम नहीं रहा." which would have been difficult if you spend a lot of money in all and time in the exams, and then later on you decide that I don't want to go there. So it's a good idea that, and I have seen one of our students who went for rotation, and Dr. Mala knows her, she went to America with an idea कि rotation ही करनी है, मुझे नहीं रहना है यहाँ पे. वापस आई, बोला मुझे इंडिया रहना ही नहीं है. She was so happy to see the culture in America. She was like, I don't want to. So it is like getting a taste of the thing, how you work there, how the medical healthcare works there, and you also get to experience it. So these are the three building blocks. You need to pass your step 1 in first go. There should be no attempt in your step 1. Don't take it easy. Number 2 should be, you should have a highest possible score in the step 2 CK so that you are deserving of the best places. Number 3, US clinical experience, so that it shows on your resume that you know the system and you also know for yourself what you're getting into. This is what we are trying to bring to the table through this collaboration. We want to make sure that we create a system where, like in NEET PG, you decide preparing for NEET PG, DAMS will take care of A to Z. Even when you go for your MD, when you join your MD in a subject, after you join your MD also, there are courses that we run on the DAMS platform where we keep teaching you beyond that also. So we want to bring to you the same system that you say US will take care of the rest. We'll take care of the rest. We also try to bring in a partner for English also, so that we take care of everything. That is the idea that we are looking forward to today. And I'll ask Dr. Radesh to take over and give his insights.
So now I'm gonna let Dr. Srinivasan come just for 5 minutes, and she will tell you her experience from Kaplan from 1999 till now. And I'm really have a lot of respect for you and Dr. Sethi here, and I want to make sure the way we do it, like we do the best rotation, we want to start the best training program also. So Dr.
So hello again, everyone. I'll do it very quickly. I'll wrap it up quickly because I know students are very eager to hear Dr. Ratesh's, the side of the story. But hearing my side is USMLE has been something which I have been doing for the past 30 years. As he rightly said, 1999, we brought Kaplan to India. I have had the opportunity to work with Kaplan in the US with the academic part, with thousands of students. Some of my students are program directors today, like his wife, and so many other people who are working with us right now. And being a part of Dr. Sumer's team helped me, being totally embedded with the USMLE structure, because people in India want to know what DAMS is doing. We have a reputation and a name to uphold, and that is the reason why we want to go with the best. We want to go with people who are completely transparent and honest, and we found such a partner with Dr. Ratesh. He is doing wonderful work with rotations, and we on our hand are now trying to simplify the training program for USMLE, because USMLE has changed over the last few years. Not only last few years, since COVID, there has been a transition. There used to be clinical skills. There used to be so many. Step 1 used to be a scoring exam. Step 2 now has become a very important exam. A very high score is required. Despite the scores, there are so many other things that students are requiring, and it's never going to be a simple clearing the exam and getting through. So when you have so many different aspects to take care of, we wanted to have a one place to go to, because you're already complicated with so many things, the expenses, the visas, the travel, and so many other things. At least you should not have a problem with the mentoring and the right information, because सबसे ज़्यादा जो बच्चे यहाँ से निकल जाते हैं वो वही बच्चे होते हैं जिनको correct information नहीं मिलती है. Despite effort, despite money, they don't get the right information. So we are striving to give you the best information possible at possibly the best cost as well. And I think Dr. Ratesh and his team are just going to make a very nice amalgam with DAMS, and we are going to give the best possible help for all our USMLE students. So no more now, just for Dr. Ratesh. Take care.
Thank you, Doctor. Okay, so let's start with the slide now. We can do the slide a little bit down. So next 2 hours, you guys should not leave your seat. Okay, don't even use the bathroom, because every slide is important, and every slide will have information which all of you will need. Okay, so whenever I do this presentation, one thing I tell: the secret for success is information. People with low score match, people with attempts match, people with high score don't match. Only difference is the information. You need to get the right information from the right people. From today, if you find anyone giving you any information, check their credentials. Very important. Who they are, how they are telling you these things, because so many times students come, Nikhil, right? They come and, sir, is this important? I heard. I said, you heard from where, right? Who? What is your source? If source is not reliable, how will you know information is correct, right? So credentials are very, very important. Go to the next. So first, I will show you my credentials, right? Before even I start. So this is my credentials. I went to medical school in Patiala, Government Medical College, Patiala. And after that, I did 2.5 years of DNB surgery in India, because I could not get the PG. So, you were asking them why America. So for me, I had nothing here. Like really bad experience, mostly PTSD from India. So sometimes students do ask me, like, do you miss India? I said, no, I don't. No, because, there are so many things which were like US gave me. Like US gave me much more than even I thought in my wildest dreams. Like it gave me so much success. I never thought about it. And I did only 2 things. I was honest and hardworking. That's it. Nothing else. Honest and hardworking. So when I went there, I did my internship in SUNY Downstate Medical Center. I worked there before 6 months with a doctor, and I consider her my mom in America. Her name is Dr. Mary N. Banerjee. I have utmost respect for her. If I'm in US, it's because of her. You guys also, if you have your mentors, never say bad things about them. They help you, and be respectful. I have seen sometimes students come to us and then they become, these try to be these super shots. And whenever somebody say bad thing about their mentors, that person I will never take. I will never take that person for a job, right? Because if you cannot respect your mentors, who you gonna respect, right? You will never respect your patient. So always, and I respect her. She is an endocrinologist, the top notch. She is the one who actually was the part of, everyone know about A1C, right? A1C should be this and that. The study where it all come from, she was the chief investigator, and she made me part of that. It was a ACCORD trial. So one of the biggest trial on diabetes you guys can see. She also introduced a term called flatbush diabetes. So in Brooklyn, there is a very weird form of diabetes. There's like, we have diabetes ketoacidosis and hyperosmolar. So actually in Brooklyn, so hyperosmolar type actually become with ketosis. It's very complicated sometimes to manage. So she did a lot of work on that. Amazing. And she actually got me into the program also. And she made my life in America. And I'm like really thankful to her till date. So after that, I worked in the hospital for 3 years as an assistant professor of medicine. And after that, I opened Brooklyn Cancer Care in 2012. It's a freestanding cancer care. Now we are affiliated with Mount Sinai Hospital and Icahn School of Medicine, where I'm assistant professor of medicine also. In America, like Dr. you were asking me about doctors, we cannot work without affiliation with the hospital. Every doctor will have an affiliation, right? Now, that doesn't mean we spend too much time in the hospital. Most of us spend most of the time in our clinics, and then we have affiliation with the hospitals, some teaching responsibilities. Like I go to Mount Sinai every Friday, right? But 4 days I am in my office. Yeah? So every doctor does that. So whenever you ask someone, oh, this doctor is with a hospital, has to be. You cannot work without that. Licensing is, you have to be affiliated with an institution, right? So around 2015, when this clinical experience, when we did, there was no need of clinical experience for 10 years. I think this started in around 2010, that you have to have clinical experience, right? And in my presentation, I will tell you why they did that. So at that point, we started Brooklyn USC. So very interesting story about the paid and unpaid. So sometimes people ask me, like, why charge? There was no charge in the beginning. I never charge for first 2 years. Students come, 1 or 2, they work with me, and then after that they match. So it was working very well. Then I started having these students from the companies come to rotate with me. So first I didn't realize like what's going on. And one time, I still remember, there was 2 students, one girl from India, one from Pakistan, both of them. And we were just, it was long day. I work really hard, like these guys know, they work with me. I work long hours. So it was 10 p.m. I think. And we were about to go home after clinic is done. And I just asked them, I said, how did you come here? Like, how do you know who I am? They said, this company, we pay them money and, they send it. I'm like, okay. And the amount of money was $4,000 a month. So at that point, I'm like, okay, we need to do something about it. So what I did, I'm like, okay, let's start a company. So we registered a company named Brooklyn USC, and we started advertising. Come do rotation with us for free. Nobody came. Students still coming from the companies paying $4,000. Then I have a student from Gujarat. I'm not going to bring his name. So he said, sir, you need to charge. He said, people will not come to you if you don't charge, because they don't respect free things. So then I told him, I said, listen, okay, so we will do it. But few things I told them I want to do. First, price should be very genuine. I came from very poor family. Like literally, if you come to my house today, you will see. All the Indian movies now, I love Bollywood, by the way. I love movies. I wanted to be an actor when I was young. So I watched a lot of Indian movies, and lot of movies, they are very, very good, these low budget movies. So those houses they show in those movies, they show, there's a movie I was watching, so the girl said, my papa is coming to your house, make sure you have 6 cups, same type. So our house never had 6 cups of same type. You will get tea in different 6 cups. So all those sheets you see in that house, my house is still like that. So parents still live like that. We tried our best to move them. They don't want to move. We are living in an old house, it's 105-year-old, and still right in the middle of the city. They don't want to move. So I said it has to be affordable, and we're going to give information honestly. We're not going to tell them that, okay, I will send you to this hospital, do that, and then student come to us, which normally people do. They will tell you, we'll send you to the hospital, and then they will show you on the computer a hospital. These guys know that. They actually did all these things, and they're going to come actually after me, and they're going to tell you their experience. And then student come to me, they're like, I paid $3,000 rocks up to this company and come to you. I said, but I charge $1,500. They said, yes, because we called your company. They said, Dr. Khillan do outpatient, and this company said, he do inpatient. And I said, why? Like, what do you think? Didn't you even ask the name? They said they didn't give us the name of the doctor. They said, we will tell you name after paying. So see, so be careful when you do these kind of things. So I told them, honest, affordable, and make sure when student comes, they get the best experience about this and best information. And I still remember the first Brooklyn USC, actually, I flashed. I put that company for something else. So actually the name of the company register is Brooklyn USC 1. I have to create a second one after 2 years when we start taking fee, and then slowly I still remember 2000 COVID came, and that was the time when we were in full power. We have so many students start coming and matching. COVID was the best year for us. We had a match, I think around 85 to 86%. Not everyone matched, let me tell you that. If somebody tells you, oh, my results are 100%, they're absolutely lying to you. There is no 100% in this world, right? Every year there are some students who don't match, but what I have seen is, but good news is, I have seen if a student worked with their heart and put effort in it, they will match. Maybe it will take 1 year, 2 years, 3 years. That is not sure, right? But they match. You cannot quit in this, because this is not like, as Dr. Sumer said, this is not like just scores and then you get it. This is the process. It's the whole process which you need to go through. And I will show you why every aspect of it is important. All right? It's not hard. It's long, and we have to be consistent. And also, one thing, as I said, every country I go, and I make my presentation based on that. We are not very particular about timing. We are not. We don't go to the places on time. We don't look at the deadlines. We always think, it's okay. Ho jayega, koi baat nahi. Not in USMLE. Not in USMLE. So right now, I am affiliated with Mount Sinai Hospital, New York Methodist, Cornell University, and Brooklyn One Healthcare System. So these three systems I work with. So this is my journey, if you guys want to see. So medical college, whatever I told you, Hem-Onc Fellow, then Brooklyn Cancer Care, Brooklyn USC. Then we have to actually start a housing company also, because all of you guys coming, where to stay. So we made this housing company where we have housing for boys and girls combined, and also exclusively for the girls. We have housing where, I have a lot of students coming from Pakistan. So they want females and males on the separate floor. So we have all that arrangement also. Okay, next. So this is the story I told you. So I still remember the fee was $1,000 for step 1 and $1,000 for step 2. I think if you keep with the inflation now, it's like 5,000, right? It's 99 to now, yeah? So now you look at the return of that investment for us. So it was worth it, right? So I know it will cost you money, but one thing I will tell you, if you're successful, the return on that investment will be unbelievable. And I tell in my every lecture, 10 years, 15 years from now, if you are a successful doctor in America, you will have so much money, you will not know what to do with it. And I will say it again. Yeah, so that's the investment. Okay, next. So this is a very important slide. Look at this slide. This is the result. Match came, right, a few days ago. So look at this slide. So this slide, I'm just, for Indian students. If you look one of the programs, look at this, where these students come from. In one program, Dow Medical Colleges in Pakistan, Liaquat Medical College in Pakistan, Dow Medical Colleges in Pakistan, Alumni Medical College in Pakistan. Out of 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 15. How many are from Pakistan? Can you count? 9. Out of 15, 9 students from Pakistan. Unbelievable. We are 1.5 billion Indians, and we beat them in cricket match every day. But they're beating us in USMLE, right? You think they're smarter than us? Similar smartness. We, all of the doctors, we have a similar IQ. We always think we are so smart. All of us have almost similar IQ, 5 up and down. The difference is information. They give each other good information. We don't. We don't. What we will do, I know people will come here, they will do these seminars, and they will tell you, okay, go to this hospital, then go to, I still remember the scene from that movie PK. So there was this guy, his wife is sick, and the Panditji said, Amarnath jaiye, वहां जाकर आगे 15 किलोमीटर पैदल चलिए, वहां से एक पता नहीं ज्वाला मिलेगी. Right? The wrong number. Remember the scene? Right? So, hospital rotation, nothing wrong with it, right? Nothing wrong with it. But sometimes you don't get it. You don't get it. You keep sending cold emails for a year, 2 years, 3 years. What you should do? And then they will write on their things. We have students who match year of graduation 2006. This is 2026. Do you want to match in 2046? No, right? Or 2056? So, like, what is the point of wasting 5 to 10 years for those hospital rotation? I have a student who matched, and he came to me and he was giving lecture. He said, I'm still waiting for my rotation in the hospital, and I'm PG2 now. You think all these Pakistani kids, they go to hospitals? They don't. They don't waste money. They know what to do. They just do wherever they get. US clinical experience is clinical experience you need. Wherever you get it from. Wherever you get it from. If anyone has green card or they're citizens there, a lot of students come here, right? NRIs do it. Come to me. I guarantee you I will match. You will match. I guarantee. Because we know the system now. We have the network. We know who takes what. We know which program takes students from Turkey, which take from Pakistan, which take from India. But this year, so many students from India did not match because they were looking for hospital rotations. They're still looking. I have few WhatsApp messages. I will show you at the end of the presentation to prove the point. Everything I will say here today, I will back it up with evidence. I will not say anything without that. Okay? So, I hope all of you who want to do USMLE or who want to match in America, they know that there is a foundation and exams, right? Step 1, step 2, OET. Dr. Samir said, you know, very important. Step 1, basic sciences. Step 2, clinical. OET is an English test. Very good idea, Dr. Sab, actually, to do that English thing. Well, you have to pass OET. Try not to fail any of these tests. If you are an IMG and you need visa, try not to fail it. Even step 1. Dr. Smith, he's so smart, he told you guys one thing. Because it's pass and fail, you think it's easy. Lot of students failing step 1 just because of that. They think it's pass and fail. Doesn't matter. And they fail. There are so many students who fail step 1. Do not do that. Even if it's pass and fail, you have to pass first step. Okay? And again, step 2, score. Only objective thing a director has for international medical student is score. They don't know where DMC is or what DMC is. They don't know like hospital in Gujarat, how they are. They only know few hospitals in India. All India Institute of Medical Science. Maybe somebody know PGI, somebody know JIPMER. That's it. Not more than that. They don't know Dow Medical College in Pakistan, what they do, Aga Khan. They don't know. So they know what Mount Sinai system is, what is University of Wisconsin, what is University of Chicago, what is Northwestern, what is Columbia, what is Cornell. Those students, even scores are a little low, and the person is from Cornell, they will look at that application. That this kid went to Cornell. Okay, score is low, but kid is smart. That's why undergraduate is from Cornell. Here we don't know, right? So what the objective thing they have is score. That's why they put lot of emphasis on score. We did one more thing. Jaskaran actually matched this year. He will come and he will tell you guys his story. So Jaskaran with 3 more students, they actually created a database from last year match 2025. There are 687 internal medicine programs. 687. So I was sitting one day. I love to run my numbers with AI. I love it. I'm like, I want to see. So I have a student with me. I'm like, okay, you know, let's ask Gemini that go through this whole system and tell me how many of these programs give interviews to people who have scored more than 270. Nikhil, guess. Give me a number. Out of 687, how many programs gave interviews to people who have scored 270 plus? Give me just wild guess. Everybody, right? Yeah, out of like everybody. Only 70 programs gave interviews to students who have scored more than 270. Only 70. The reason? Programs think they have too much score and they're not going to come to their program. So, and you know what is the best score where a student got the maximum interview? 251. 251. Because Gemini run, you know, all the numbers, and every program actually gave like around 99% strike rate on 251. Lowest score was I think 19. I think that's the minimum to pass step 2, right? And maximum was 273. So, you know, if somebody has 280, I don't know if there was no 280, there was no program which gave interview to 280. And this is the real time, actually, from the program. This is not, they're making it up. This is the data. And I'm going to show you that data at the end. Like how much information they tell you in US. That is another thing in American system. They tell you everything. Like NEET, you have no idea what they're going to ask you, right? USMLE, they tell you what they're going to ask, and they will tell you how you can evaluate yourself. Like how much you score, you will know, right? Those NBMEs, yeah? So after that comes the rotations. So again, as I said, rotations can be any part. Inpatient, outpatient, urgent care, emergency medicine, whatever you can get. But do one thing, work properly. Every rotation, take it seriously. Because every rotation, you need a letter of recommendation, right? Now, that letter of recommendation, people sometimes ask, oh, what kind of letters you give? I said, I give the kind of letter you work. Letter does not depend on me or any doctor. Letter depend on you, what you will do there, right? When Khillan came to me, he spent so much time with me. We did so many things. I gave him honors letter, right? That is the highest letter if somebody can get. But if a student come to me who don't show me his face, out of 16 days, he come once, twice, or 4 times, don't do presentation, don't do anything with me, I don't even know who he is, how I can write a excellent letter for that person, right? One thing I do, I don't give anybody bad letter. I'm Hindu by religion, I believe in karma. I feel people who are bad, they're gonna ruin their life on their own. I don't have to be part of it. So I said, I will not give it. I refuse. Like, I did not like your work, I'm not giving you a letter. It didn't happen yet. I don't think I have any students so far where I have to see. Most of the students who come, they're amazing, like everybody want to work. But difference is, so there are 5 categories of students who come to work. One, they just come for letter. Just come for letter. After that, I never hear from them. I don't know where they match. If they match, they some tells me, some don't. Then 2 students who come for letter, but they put effort. They put effort. I will tell them to do rotations, presentations, didactics, all that, and they part. Then I have level 3 students who come, they are like, Dr. Khillan, we want to match and we will do everything. And they do. Maybe score not that high, you know, so that is 3. Then come the level 4 students. Now level 4 students are who challenge me intellectually, who ask me questions, who ask me, and it's okay to do that in America. I know in India it's not the culture to question your students, right? But that's a different system. We like it. If somebody, I can make a mistake, right? I'm seeing 100 patients a day and it's goes so fast. It's possible I may have not checked some lab work. Sometimes students tell me, Dr. Khillan, this lab look like maybe we should do something. Yes, I want that. And I like that. And then level 5 students. Level 5 students, when they come, they become part of my family. They make impression on me. They make changes to my clinic for the betterment of the patients. They do things. We should do this way. We should do this way. And they are the one who become the lifelong friendship. I have an army of doctors. In last 10 years, around 1,500 students match from us. 1,500. Every program in America, I was telling Dr. Sethi, every program in America actually have is 1 or 2 students who have done something with us. Whether they have done rotations, they have used our housing, or they have sent me a text. Sometime I got this student come, sir, you remember I matched and I called you 2 years ago? I don't know, but okay. So you told me don't give up, right? So my job is to do that for you guys, right? That is lacking in Indian system. There is zero motivation and everybody tells you you cannot do it. You cannot do it. We need to change that concept. If you guys, Karan, Hardik, I want you guys to help the students now. You have to tell them it's possible, but you have to work hard. Don't tell them, "Oi, don't say that." That is the mentality of Indian students I have seen. So once they are there, that's it. Then they think no one else should come. Yeah. So look at me, 1,500 students I have from different countries. I get students from 49 countries to me. They come from countries I don't know the name of the country. Sometimes I have to look up on the map, like where and how did you find me, right? So I feel very proud of that. And I feel so proud of all these people who match. And I want to continue that. And I want to help Indian students this year because last 2 years, the match rate for Indian students went down. Just because of this narrative in India on the YouTube, all these people telling you guys, keep sending old emails, keep doing this, keep doing that. And then sometimes rotations also. We don't pay anybody any cut or commission. Nobody. lot of students ask me, influencers, sir, give me some commission, I will send you students. I don't have more space for students. I cannot. Kishan, can we take more students in July? No, I don't. So I don't need more. I will give that commission discount to you guys because you need more than them. They're making money now. Hitesh is getting a paycheck now. He is. He's good. He's good. Hitesh called me. When he came to me, he sent so many students to me. He never asked me single time, sir, can you give me commission? Never ever. He's sitting with me, that's why. That's the reason he's sitting with me. And other people's are not. Okay. So make sure when somebody tells you, oh, I get your rotation, ask them, why you will get me rotation? What is your interest in it? Nobody does charity work in this country, especially in America. There is some sort of, thing. And then they will come up with these names of the rotations, which does not exist for you guys. Let you do a sub-internship. What do you mean sub-internship? You know what is sub-internship? Sub-internship is for US medical students, when they become 4th year, they have to do sub-internship 3 months in internal medicine, 3 months in surgery. How are you going to do that in 1 month? They will sell you sub-internship for a month. I can sell anything. I can say, let's go, let's do sub-internship. You're happy. I am doing sub-internship. You will not even ask him, oh, by the way, what is sub-internship? What is it? Right? सब बेचते हैं, बेच रहे हैं सामान और जिसका कोई मतलब ही नहीं. Right? There is no meaning of that part. Because what you guys can do, a month of elective when you are a student or an observership when you become graduate. Everybody knows that it's written legally. Right? And there is a law which actually permit you to observe under a doctor. And when you go for your visa, make sure you know that law and you have the paper with you. Online available, that law. Okay? So there is a law which you can observe under a doctor. After that, you do steps, now you do rotation. Now that's where our student actually, we help them the most. I think, just how many times we spoke about application and at every step, right? Yeah, rank order list, how to do the programs. I got 7 or how many interviews you got? 14 interviews. And then just go and ask me, like, I like this program, that program, and this program looks like I have more chances. I said, but which one you like, right? So everything we went through, right? Hardik came. Hardik, you got how many? Just 1 interview. And he met. See, so it is possible. Everything is possible. If you have that 1 interview, right? You have to make sure you will do everything in this world to get that. That's it. That's it. Rest, leave it on God. Give 100%, not 99%. Give 100%. So the part of the application, and we're going to go over it in a little bit detail. So it has residency application, personal statement, interview preparation, signals, and rank order. And then of course, residency match, then career start. Now we're going to talk about fellowships and where we can make more money and how. So lot of things, right? As I said, so these are level 4, 5 students. They're all, and they're still with me. Like wherever I go, they come with me, and we have some online. They will come. They're waiting. It's midnight there. They will come. You guys can ask them questions. They are PGY2s, some 3s. I had actually 2 PDs who wanted to come, but it's like 5 AM in US. So I'm like, okay, next time. Next time we will do this little bit in the evening time, so it's morning time in America. Okay, next. So these are the rotations we have, by the way. Internal medicine, hematology, oncology, gastro, cardio, nephrology. Lot of questions I get, sir, I want to do cardiology. Yes, you can. You can do cardiology, but you have to do internal medicine before that. So right now, you guys apply for internal medicine, right? Then fellowship later. Now, question they ask me, I want to do cardiology. Should I do all cardiology rotations now? No need, right? Because at this time, it doesn't matter what you want to do. This time, focus. Very important. In life, focus is very important, right? So I listened to Satguru. So one time, a young man asked him a question that you always say, work hard, everything will be okay, everything. I try to do so many things, never successful. He said, you are not successful, you're trying to do so many things. Try to do one at one point and do full work on that. And if you're unsuccessful, come back to me. So focus is very important. You guys have to focus that this is what I want to do this year, and that's it. So internal medicine we have neurology, excellent position we have. We had psychiatry rotation where Hardik actually worked with the psychiatrist. So right now she's not taking any new students, but we are looking for a few more doctors to work in psychiatry. We have pathology, pediatrics, 3 pediatrician actually, very good ones. We have a dermatologist, we have an ophthalmologist, a plastic surgeon, and we have 3 family medicine doctors. One is a program director. So these are the rotations we have. Most of the students do medicine and family medicine because, you know, that is the specialty which mostly international medical graduates take. Next. Okay, now good news, right? You guys want good news, right? So look at this graph. And all these graphs are available on NRMP, by the way. I didn't make them, they are there. I just, you know, picked them. And I picked the ones which you guys, and I will show you now how to read them. So US MD seniors are medical students from US, right? Then US DO seniors, so there is an MD and there is a DO course. Little different than MD, it's called osteopathic medicine, right? So they're US students, you can say them, they're US students. Then there are international medical graduates who are born in US, they are US citizens, right? They are US IMGs. Then there are non-US IMGs, all of us, plus green card holders also. I don't know why green card holders, they consider them as non-US IMGs, right? But they get the same amount of credit as citizens. So their life is much easier than our life, okay? Then comes others. I don't know what the others are. So we are non-US IMGs. Look at the green curve. So from 2016, look at the match rate. We always hover around 50%, above 50%, right? So what that means is if 1,000 people apply, more than 500 will match. How many seats we have in NEET? So what is the percentage? Match rate.
Abhina, now this year is pretty good. People even minus marks are this year getting PG. It's not that bad now.
No, sorry. Let me reframe the question. The government seats where you don't need to pay like crores.
So, now in the last few years, like in 2007 or 8, we would say 8,000 ranked it would be the cutoff. Now we like even at 40,000, 50,000 ranked there.
Right. And how many?
2 lakh people have it.
So
25%.
25%, right? What is FMG pass rate?
25%.
Yeah.
25%.
So this is better, na? 55%. Much better than any exam any day, right? Now what is the difference? If you are done with NEET and you become MD here, it will take you 10 more years, even if you are MD medicine, to establish yourself. In America, 3 years. Once you become attending, you are set for your life. Not for life, for generations, right? $300,000 every doctor gets in America. $300,000. You calculating in your mind, right? 19 to 94, right? Right? Yeah. I mean, cost is also there. So when you become a doctor there, and when your first check comes, do you convert now? You still convert? Less now, right? So when you start earning in dollars, then you stop converting in rupees. Before that, you do convert. Yeah. I think I was converting up to like third year. Then when I become attending, then I stopped. So yeah. So that's why what I feel from that picture I showed you, where lots and lots of students from Pakistan matched, I think not enough students from India are applying. Not enough. That's why we are less in those pictures. We are 1 or 2. We should be out of 15, at least 5. If there are 9 from Pakistan can come in a program out of 15, we should be at least 5. We are 5 times more than them. I think less Indian students are applying, and I think more should apply. There is an opportunity. Easily, it can be done easily. You don't need to wait for cold emails from years. You don't need to, if you don't get Cleveland Clinic rotation, it's okay. None of them got, and they matched, right? They matched. So if you get it, good, do it. But if you don't get it, it's not end of the world. Nobody cares. They want to look at your personality. They want to know what have you done in your rotation. And these PDs, they are amazing people. Their job is to get good people. No matter what you do, Dr. Samir said one thing. They want honest people. They said, if India do this system, it will be so corrupt. But over there, somehow they know how to extract information from you. Give you an example. A lot of you guys, there's 100 research papers, he said, right? Like, we need research. That's what they do in US thing now. There is a journal called Curious. It publish every garbage. No problem. Medical literature की बाट लगा दी इसने. कुछ भी डाल दो उसमें. मेरा ख्याल if I write a letter, I write a paper that कि कुमिडिन 100 मिलीग्राम दे दो और वो बंदे को फायदा करता है without anything, I think वो publish कर देंगे. पैसे लेके कर देंगे वो publish. And it's dangerous. American PDs, they know. So what NRMP know this. So they found out that this is dangerous. So now they change the research criteria. Now they want to know, when you do research, they want to know your role in that research very clearly. So you cannot put those 100 papers, right? You know what you have done. And I know there are so many residents, they do this online, they read that, give us $100, we'll put your name. It's very common here, right, in India. And students don't know anything about those papers. So what happens when they go for interview? Now interview, nobody come prepared for interview, right? No one has time. So what they're going to do? They're going to look at Sumit's file. Sumit, okay, you did research, right? Or this is your personal statement. He wrote something about research in his personal statement. So that is something different than scores. Scores, everybody has scores. Now, when you are on the interview, then score is gone now. Now there is nothing about score. Now it's about what have you done in America. They ask Sumit, his first paper. Like, Sumit, this is paper. Can you tell me what you did? So if Sumit has done that paper, I can guarantee you, he will be able to answer any questions. Like sometime I interview and students give me this sign, I have done work on breast cancer. I am a breast cancer specialist. 50% of my patients, cancer patient I treat is breast cancer. I super specialize. Like, I have a board in oncology. Then I have now a board in breast cancer. I know every paper exists on breast cancer. Now, if you come, I did research on breast cancer, what I'm going to do? I'm going to ask you a question about that, right? So if you can't answer that question, so what comes in the PD's mind that you have not done it yourself and your whole application is false. Whole application is false. And they have 5,000 more for 10 spots. Every program which gives visa, they have 10, 15 spots, they get 6,000 to 7,000 applications. So they will take 1 second to throw yours. So that is the difference between match and non-matched. Because now scores are fine. They're not looking for scores now. They have screened you. And I will show you, there's a slide, what program directors look into your application. Okay, next. So this is actually 2025. How many spots you have? Guess how many internal medicine spots we have in America? Do you know? Yeah, so we have exact number 11,362, right? So medicine, lot of spots, right? Now, why we get so many medicine spots? Because not US students don't want to do, not that many. Of course, they are the maximum one, like, they still go for internal medicine because positions are very high. They want to go for radiology, they want to go for orthopedics, ENT. So there are primary care spots and internal medicine spots which are more than they need. So I always say this thing, every time something happens, they're like, oh my God, this time visa gonna be done, this and that. Now, let me tell you, all of you, I know a lot of people are watching me all over the world. America need 10 to 11,000 doctors extra. They have 43,000 residency spots and they create around 32,000 medical students, like US students, right? They need those 12,000 doctors. It's not they want to take you, they have to take you. They have no option. Because even if President Trump thinks today, I'm not going to take any doctor from the world, I'm going to create all here. And he may think about it. He may. And he said, okay, let's open new medical schools. It will take 5 to 10 years to create 12,000 medical students. And American population is getting older. Now they need more doctors. So I will show you a slide where it's clearly shown that number of spots are increasing every year. So even if they increase the medical school, number of doctors they need is more. That's why they give visa. Otherwise, it's not. It's not like they are looking for, diversity, this and that. It's need. They need it. Very simple. Okay. Next. Now, take a picture of this if you guys can. This is a very good slide. So this is number of residency spots from 2016 to 2025. To prove my point, 2016 there was 27,860 spots. 2025 we have 40,041 spots. Right? Even if there are more students who are becoming doctors in US or US students going in Caribbean islands, look at it, almost double in 10 years, right? And it will keep. And in America, if they need it, they will create positions. It's not like India. If they need it, they don't care. They care over there. Okay. So, and look at that non-US IMGs. Always in last 10 years, 50%, 52, 56, 58, up to 61% in 2020 in COVID. I told you, right? In COVID, so many students like, it's not going to happen. It's the end of the world. And that was the best year. Who in COVID? Like there were some students get stuck in our housing. They couldn't go back. So I'm like, okay, come to the office. Like some of them are not even doing rotations with me. Mayuk, remember? So he's a nephrologist now. And I went to the house one day. There was some issue. I said, who are you? He said, no, Dr. Khillan, I came here for rotations. Now I'm stuck. So I said, why are you sleeping? It's 11 o'clock. Get up. Let's do some see some patients. He worked with me for 3 months. He got matched in Brooklyn, Maimonides Hospital. He did his fellowship in nephrology, and he's an attending now. So there will be always something. There will be war. There will be COVID, something. But Republicans comes now, we cannot match. Democrats come, we cannot match. They need 11 to 12,000 doctors, and they need them. So if anybody tells you, tell them, okay, just listen to them and do what you want. Okay. So in 2025, so this is comparison between 24 and 25. So there are 1,734 more certified positions, and there were 231 more certified programs. Okay, this is new. And they also created 877 more positions in primary care. Now, what is primary care? In America, not many doctors want to do primary care. Like a general physician, like we call MD medicine here. So that a patient can go to them for their general medical issues, pressure, diabetes, vaccination, like a routine visit, right? Not many people want to do it. So what they're doing now, they are opening up these primary care positions. So if you apply now, so when you apply in a program, so let's say SUNY Downstate Medical Center, they have 50 positions, which is internal medicine track, and they have 10 positions for primary care track. They are separate, extra. So not many US students going to apply there. Opportunity for us, apply there. It's for primary care, but if you change your mind, you can do fellowship also. They don't say no, right? It's hard, a little bit hard, because they want these people to do primary care. Primary care is a fantastic branch, right? Like if you don't get anything, I will go for primary care anytime. So every year they are putting more and more positions. So when you guys apply, please apply for primary care. And they have 2 different codes. So you have to apply, like if you're applying to 10 programs, so you have to apply 10 more primary care programs, all right? That's why more students are matching now, okay? Now, why US is better, right? India is progressing very fast, very fast. And why? What is the reason? Why India is going so fast? What is the strength of India? Population, young population. Most of Indian, how many? 60% are, I think, less than 30 Indian population. Young population. Second, young population who have nothing. When you have nothing, then you make it. When you have something, then you're like, it's okay, right? You have nothing. I always tell, economics of India and economics of US. Just gonna now in US in the next 3 months. What is the difference between economies, Indian economy and US economy for a common person? Where does common man in India spend their money? Most of their money, which they make. On what thing? You guys all know that. Food. 70% food. How much of your paycheck you spend on food in US? 10%. Only 10%. In India, a lower middle class person spends 70 to 80% of their daily earning. Like a daily wage guy who makes 500 rupees, he spends 300 rupees on food to 400 rupees. In America, where you spend most of your money? What is your biggest cost? Rent. No, rent. One check go in rent. That is the major difference in US economy and Indian economy. Because food, prices of food, although are not that high, but because of inflation, you get less in a big amount of money. In US, they keep 3 to 4 things very cheap. Bread, milk, and gas. Because these are the necessities, and they keep it very cheap. You can get bread for $1, milk for $2 gallon, and gas for $4 gallon. Gallon means around 4 liters. So it's very cheap as compared to India. Okay. So doctor is a very prestigious and rewarding profession. I feel so bad when I see those people beating doctors in India without any reason. I mean, that is very frustrating, right? There's nothing like that in America. They respect doctors a lot. I'm not saying we don't deal with tough patients. We do. Like Hardik actually worked there with tough patients on the road. Actually, he will tell you, like he used to go there in their houses when he was doing his psych rotation. So one part was he will tell you how he did that. But nobody beating doctors or nurses or anything like that. Very respected profession. Right? Wherever I go to bank, the manager comes on to me. They come to me. Like if I tell them I'm a doctor, no cop give you a ticket. They say, okay, doc, don't do it next. Like they respect doctors. Second, financial stability. No matter what happens, doctors are very secure in America. There will be disease in the world. There will be need for the doctors. So you are set. I have doctors 81-year-olds still working. Come to the hospital. They tell me what should I do now? I have no kids at home. I'm free. So they come. So up to 80, 85. Because there's need for doctors, right? Access to state-of-the-art treatment. Very important. My brother is a very smart kid. So I'm the dumbest in my family. We have 2 brothers, 1 sister. My sister is, I think, the smartest. He's a gynecologist here in India. My brother is I think he's now associate professor of medicine in Indiana University. So he just teaches. He don't, So he did his MD, MBBS from Nagpur, and then from Amritsar he did his MD medicine. I told him to come to America when he was intern. He said, no, I like India. It's good, amazing. Then he did his MD. After first year his MD, he called me. I want to come to US. I don't want to stay here. I said, why? He's very smart kid. He said, I get patients. I diagnose them. I give them treatment. Half of them have no money to buy treatment. They die. Half of them who buy treatment, the medicines are not good. They die. Everyone is dying and I'm very depressed about it. I don't want to stay here. I said, okay, come there. So when he was in his second year, he was the best intern, always 99. Best resident, best intern, everyone best. And he's like, same way I used to work in Amritsar. I never was able to save anybody. And nobody's dying in America. Because, guidelines are same, right? We use the same medications. Like your checks are there, NCCN guidelines. You guys come there, we watch NCCN. Sometimes I tell them, you guys can treat cancer by looking at NCCN guidelines. Like, that's what I do, right? I read them. But the things, patients don't have access to all those treatments. And I'm talking about basics. I'm not going in expensive drugs and all that. I know it's changing for some part of Indian society, but I think it's only top 10, 20, 30%. After that, it's miserable, right? Over there, everybody has access to state-of-the-art treatment, even if they're poor, because government aid them. They have insurance called Medicaid, and Medicaid covers most of these treatments, right? You have opportunities for top-notch research. Dr. Mala, actually, she went out, so we were talking yesterday. So she said, All India Institute students, they think they don't want to go to America because they don't get top-notch universities. So I said, top-notch universities are for US students, right? Like, how many foreigners we take in All India Institute of Medical Science? Tell me. 2 or 3, right? Yale take more than that. They do more than that. Cleveland Clinic take more than that. Out of 50, they do take 6, 7. We don't even take 1. So those institutes, premier institutes in US are made for US students. Now, can we go there? Yes, we can. But you have to enter the system first, right? If you think here that because I cannot work in Cleveland Clinic, I'm not going to even try, then it's not going to happen. So what you do, my best friend, he is from Pakistan, Dr. Osmani. He's chief of myeloma service in Memorial Sloan Kettering Hospital, the top hospital, cancer hospital in the world. He come to us to give lectures to my students when they come there. So he told me one thing. Same way that All India Institute, I'm telling them that story. All India Institute students, same thing he said. He said, when I came to America first, I felt very frustrated that I have to work so hard. I'm so smart as compared to US students. By the way, US students are very smart too. The kids who come to medical school, oh my God, they are geniuses. It's very competitive actually. Over there, I think go to medical school is harder than India. Because in India, if you don't go direct channel, you pay and you go to medical school. Over there is nothing like that. You have to be good. So he said, then I realized, same thing what I said. This is their country, right? They're going to take them. So, but we have to go up the ladder by working hard. He worked in University of Arkansas, which actually give us all the guidelines for myeloma. They are the Makkah, where they actually invented multiple myeloma treatment. He worked there 17 years. And now he's chief of multiple myeloma in Memorial Sloan Kettering Hospital from Pakistan. And all the US students are under him. See, that is the way to do it. You cannot say, oh my God, I don't get Cleveland Clinic, I'm not going to go. And what are you going to get here? You're going to get Cleveland Clinic in India? Here's nothing. You don't have even money to get the medication, right? So, you have opportunities to do this research and work in these top institutes. Maybe not in the beginning, later on. Become a hospitalist in Memorial. They always need hospitals. Go to Cleveland Clinic, work in cardiology department as a hospitalist for 2 years. There's a very good chance you will get a cardiology fellowship in Cleveland Clinic, right? So there is way to do things, but nobody tells you guys these kinds of things. Investment in healthcare. Go back. What is India's GDP? Huh? No, that is population. GDP. How much? Around 5 trillion. Yeah, around 4 and 5 trillion. So India is now 3rd or 4th biggest economy in the world. Right? Sounds amazing. Right? Sounds amazing. But per capita, we are still very, very low. There's a lot of work to do. Right? America spent $3 trillion on healthcare. $3 trillion. Same amount of Indian GDP, it spends on health, right? Sometimes people, in India, they're like, oh, India, I'm like, you cannot come close to US in next 100 years. That I will tell you, 100 years. But it will come. It will take 100 years, right? I don't know, I have a scientist who I read about, so I'm reading a lot about longevity medicine. So there's a new specialty in America, longevity medicine. Now, Jeff Bezos don't want to die. He wants to live for 200 years. And he's doing something about it. So he had few startups, which he's, So this scientist, he was from Poland. Excellent in longevity medicine. Real guy. Like, he has his, he's close to win Nobel Prize. He said, do not die in 15 years. Do not die in 15 years, because after that, you're going to live for 150 years. समझे मेरी बात? 15 साल मत मरो, फिर नहीं मरोगे जल्दी. Because what medicine did so far, we treat the symptoms. So now, what they are doing, they are reversing the aging DNA. So aging ko hi reverse kar. And some estimates are 1,000 years. How that is sustainable on the planet, we don't know. because now, so what I feel, out of India, nobody's making kids. American population is negative, Europe is all negative. You know, I think India or Pakistan, some countries make the kids, which is slowly going down. So I think that's where we'll make less kids, but people will live much, much longer going forward. And most of the treatment's gonna be curative now. Like, we actually did a trial on a sickle cell patient in Mount Sinai. We did a genetic change in them. So we cured it. So remember that the mutation, valine, that lysine mutation? So actually it reversed. So sickle cell gone. $10 million cost. It was clinical trial. But awesome, right? Now 10 million, within few years, it will be affordable to everybody when the technology comes in. CAR T therapy. We have a new treatment, CAR T therapy. Multiple myeloma. Cure. Patient don't need anything. Yes, Karan. Anubhav is the smartest kid. He worked with me. Anubhav, what is the survival for multiple myeloma, stage 4 at this time, 2026? 17 years. 17 years. Used to be 6 months. Such good treatment. Dr. Osmani told me so, you know, because he treated this myeloma. So it's awesome. Like, you get patients with worst cytogenetics, and do you do CAR T therapy? They don't need any maintenance, nothing, no bone marrow transplant. 15 to 17 years. So medicine is changing very rapidly. And now with AI, that thing gonna be even quicker. Yeah. So that is investment in health. Okay, next. So far you guys are good? Keep going? Yeah? All right. So applicants and first year positions. So how many total applicants and how many PGY positions? So every year we have more positions and we have more applicants, right? So we are almost around 50,000, around 40,000 positions and 50,000 applicants. Now, this one, they are all US students, DO and all that. So US student, their match rate is around 100%. Everybody match rate over there because they are US. So if they don't match, like sometimes, you know, some people ask me, like, why 93%? And why is 93% US for them? So 7%, they're not satisfied. They don't want to do orthopedics. They want to do radiology. They didn't get radiology a year, so they take 1 year off. So they don't apply. So then they will get it next year. So that's why that discrepancy. Otherwise, everyone matches. So next. This is the number from 2026. There was 48,000 certified applicants. Total positions were 44,344. US med seniors match rate 93%. US citizens 70%. Non-US citizens, non-US like us, 56%. Yeah, I will take that odds anytime. That's very good actually. 56% is very good. Next. So this is 2025. So it was 60% for non-US IMGs. This year is a little bit less. But don't get scared. I know this Instagram is full with, oh, this, like, you know, disaster happened. It's okay because less people applied. Less, because of all these, the reason for this is because less people applied, because these people scared the shit out of you. That Trump is there, you will not get it. Nothing will happen. And this year is the best year to apply. I will tell you why. There are 72 countries which have visa ban. 72. And it's online available. So less students from that countries, and I feel bad for them actually. Because doctors, you know, I always feel that there should not be ban on doctors. Doctors will save lives wherever they go, right? Any visa ban, anything they do should not be on doctors. So I think that may help us because, you know, our competition, like, you know, I think Pakistan is in that ban country also. So, but actually it's not for visitor visa. It's for immigrant visa, like green cards and stuff. So how that will impact, I don't know. But I think there is a little bit more chance for Indian students this year. Next. 2024, let's go next. This is also the same thing in a different format. Next. Okay. Now, this is a very important slide. So sometimes, you know, I feel students come and they're like, I done my rotation in Kansas City. Hitesh, you are in Kansas City? Where are you? Yeah. Oh, you're in Kansas City. So, you've been, right? Yeah. Right. Now, if you do your rotation in Kansas City, And now look at the positions in New York. There are 5,000 positions. And how many total positions I said are there? Around 43,000, right? So 8% positions are in New York, right? Go next. 3,000 in Texas, 8,000. Next. Illinois, 2,000. 10. Next. Florida, 13. New Jersey. So around 15, like almost 50% positions are in these states. And if you don't do rotation in this state, your chance of match is less. Because I will tell you the reason. Tell them, what is the difference between a doctor in New York and doctor where you are right now? You work both places, right?
So the workload is more in the major cities like New York, New Jersey, Illinois, like Chicago mainly. And the population wise, like I'm working in a basic like suburban areas where the patient load is not that much, because most of the people think that they have a city nearby, so they go to the big cities like Dallas. And so mostly everyone wants like a better treatment, and the treatment is almost same, but the higher centers, like we are suburban and we have a higher center, like if we have a sick patient, we want to transfer him or we want to airlift him to different hospitals, and most of the big hospitals are in the major cities. So that's why the workload and the more patient population is in the New York, Chicago, most of the famous universities, everything is there.
That's where most of the positions are. And you cannot just go to Midwest or do your rotations in some of the small cities and go for an interview, because they will ask you one question. And I think this is the hardest question. All my students say, hardest question is, what you will contribute to our program? Right, Jiska? They ask, everyone asks that question. Why will you take you? Right? If you tell them that I have worked in Brooklyn, I have seen like 100 patients a day. I can take that stress. Medicine is stressful. Okay? If somebody say the other ways, they are just lying to you. Always stressful, and we have to work. Internship is hard everywhere in America, right? So they don't want to take you, match you in the program, and then you're not able to do the work. Like you're like, in Kansas City, I didn't work that much, and now I have to do so much work. So they want to know that you have worked here in New York, and you know what it takes to be a doctor. So it's very important to do rotations in these. That's why I actually brought those slides. Oh yeah, and yeah, not only accent, the cultural ways, like diversity. Now New York has people from more than 100 countries. Like everyone comes to clinic, everyone speak English in a different accent. Russian, Caribbean, Jamaican, from Trinidad, from India, from Greece, Italian, everyone, right? So if you don't know that, so you cannot cope up with the, with the system. Oh, we have over there? Okay. So, this one, okay. Okay, so this is 2024. So that's fine. You can go to the next one. This is same thing. Oh, hold on 1 second. Actually, yeah. So this slide actually tells you the 6 main specialties. Okay, we got it. 6 main specialties where most of the international medical graduates, they match. And I will tell you the reason. Look at this. So internal medicine, there are around 10,000 spots. So US international medical graduates, I removed the US citizens from it. So US international medical graduates, and look at the percentage. 30% out of that 10,000, that's around 3,000 positions, actually were taken by non-US IMGs, right? Go to the family medicine, pediatrics, psychiatry is I think a little bit more now than 6%. Neurology 20%, pathology 30%. So there's a good chance, right? So if you apply in medicine, around 30% of those sport, 3,000, right? Now, some of you said, you know what? No, I want to do orthopedic surgery. I want to do dermatology. I want to do radiology. Next slide. You can do it, but it's not impossible, but it's hard. Look at in dermatology. Only 1. Because positions are less. Not like chances, not positions are less. Look at orthopedic surgery. There were only 916 spots, and they took 2 non-US IMGs. Maybe one of them win a Nobel Prize or something, right? No, means they, they did something, right? Surgery, not that bad actually. If you look at surgery, 1700 spots, 97. Emergency medicine, one specialty which made hard by that that serial. What was the name? ED? ER? ER, I think. ER actually came on TV. Everybody wanted to do that. All you didn't want to do emergency medicine. And then they did a study 3 years ago. They look at the life expectancy of doctors in US. Maximum was internal medicine. The lowest was emergency medicine. 54 years. It is a stressful job, and they are going away. Remember 2 years ago, there were so many positions open for emergency medicine and SOAP because US students not taking emergency medicine now. So I will encourage you guys to apply. Not you want to die faster, but if you like emergency medicine, so there is an opportunity there. You know, my role is to get you guys matched. That's it. So I will tell you everything. I'm very laser focused in my life. I don't remember anything if it's not interesting to me. So I will tell you exactly what to do to match, right? So we need to know the specialty where we can match. OBGYN, lot of students, especially female students from India, Pakistan, they ask me. So pass match rate is 2.8%, but it's there. There were 50 non-US IMGs actually who got OBGYN also. Okay, so chance is there. Now radiology, 14 they took. Now who get this orthopedics? Now who are these people who are doing this, getting these orthopedics? One, connection matters. I have a doctor from Patiala. He was I think chairman of medicine. Like, you know, those old doctors who are like really big, like, you know, who when you go to ask them questions, so you're like, sir, I read the literature, and they will tell you, I wrote that literature, okay? So something like that. So, and very rich, very powerful. I think a lot of his students were there. So his son got ophthalmology. Yeah. So now if he tells you, he come here and tell you, I got ophthalmology, that doesn't mean you will get ophthalmology. Right? That's the truth. I'm saying the truth. You will not. Because what he have, we don't have. So if we want to do ophthalmology, we have to bet 10 years of our life, 10 years, to do research and all that. And with an uncertainty, it may not happen. If you have that risk appetite, do it. I have a girl come to my office from Amritsar. Sir, I want to do surgery. I'm not going to do anything. I'm like, then you're going to get it. If you were, she said, no matter what, I will not do medicine. I said, perfect. She got surgery 3 years later. But those 3 years were hell. But not in 2046, right? 20 years is too much time. So, if you guys want, yes, there is a way to do it. Lot of research you have to do. You have to work with the best of the best people. And you may have to work there without money for a year or two to support yourself. Like this J1 visa on research you guys see, right? They don't pay you. You guys know that, right? That research positions, they don't pay any money. So you have to survive there. You have to make sure you have enough money to, you know, you have to pay rent still, you know. Hitesh gets checked. You will not. So it's expensive. Yeah. If you can afford it and you have that appetite that, okay, even if in 5 years I don't get it, that's okay. Then you know, you can do it. Next. So this is actually the data. Remember the database I'm telling you where we found out like they did not give many people with 270 interviews this year. So this came from that data. So average score actually of match students were 245, not even 250. So try to at least score. Yeah, don't score 270. So they did 3 clinical rotations, and most of them have letters of recommendation from US. Now you guys will ask me, why can't I get a letter from India? Sumir already answered that question. Right, sir? कहीं से मिल जाएगी बिना काम के, और हमें पता है वो बात. That's the reason. Very simple. It's not complicated. Then visa application. 5 साल से बोल रहा हूँ H1 मत अप्लाई करो. Don't do. You get less interviews. Now H1 ही खत्म हो गया. It's done, right? But now the question is, मुझे कई बार पूछते हैं, सर H1 खत्म हो गया मतलब हमारा खत्म हो गया वहाँ चांस. मैं कहा, who told you? You were not getting residency on H1 anyways from last 10 years. Everybody is getting residency on J1, and once you're done, you get H1. अरे वो होगा, 1 लाख दे दोगे, उस टाइम पैसा भी होगा पास. वैसे तो they are working on a law which will exempt nurses and doctors, and I think it will pass. Who will oppose this law? Right? We need doctors. Don't charge them this. Done. I think ho jayega. So, but don't worry about that thing for 3 years. Like if Jiskaran come today, sorry, नहीं मिल रहा, क्या करो? अबे 3 साल तू रेजिडेंसी तो कर यार. देखेंगे फिर क्या होगा. Right? तेरी शादी वादी करवा देंगे कहीं. ले लेंगे ग्रीन कार्ड कहीं पे. You know? there are a lot of things we can do, right? So look at life positively. Okay? नेगेटिव तो सभी बता रहे हैं और एडिट भरा हुआ है सारा, वो गालियां निकाल रहे हैं एक दूसरे को. तो अगर वो लूजर बनना है लाइफ में तो बैठ जाओ वहां, कभी मैच नहीं होगा, कभी कुछ नहीं होगा. अगर कुछ करना है तो ऑलवेज हैंग आउट विद स्मार्ट पीपल, राइट? वो सुना है ना, इफ यू आर विद 5 स्मार्ट पीपल so you are the 6th smarter one. If you are with 5 idiots, you will be okay. So then year of graduation was 1 to 5 years. So now in the database actually we have very clear indication. Exactly we can tell you which program actually take what year of graduation. Also they will tell you there are some which will say we may and some say we will. तो जिसने लिखा है विल वो तो नहीं लेगा 3, वो बोलेगा मेरी ईयर ऑफ ग्रेजुएशन 3 years है, दैट्स इट, दे विल नॉट टेक इट. बट जहां आ गया मे, वहां हमें अप्लाई करना, दैट्स वेयर वी हैव टू अप्लाई. ओके, सो वी हैव दैट इंफॉर्मेशन इन आवर डेटाबेस, लाइक टू द पॉइंट. सो मोस्ट ऑफ द प्रोग्राम्स अराउंड 250 डजंट केयर अबाउट ईयर ऑफ ग्रेजुएशन आउट ऑफ 687. लॉट ऑफ पीपल आस्क मी दिस क्वेश्चन, मैं ईयर ऑफ ग्रेजुएशन लेट हो गई. आउट ऑफ 687, 250 दे डोंट केयर what year you are. There are only around 50 programs which are very strict. There is a program which takes 1 year. मैं बोलता हूँ वो -1, क्योंकि वो डेट का हो जाता ना, so you have to be graduate and then, so that is basically for Caribbean students. क्योंकि Caribbean and US students तो same year ना, they apply actually before they finish their residency. तो उनका तो अभी डिग्री भी आती है बाद में. So that is for them. So those programs are not for us anyway. Second, there are around, I think, 300 programs which take from 3 to 5. So I think to be on the safe side, I will say 1 to 5. Okay? Now, how an international medical graduate do that, right? So all of you who are listening, like wherever part of the world you are, if you want to be successful in this journey, USMLE, you have to start it in your medical school. You have to. There's no other option. That's where the program we're going to start will be in your medical school. It will be classes here. The reason I did it here is I want to, show everyone the classes, how it works here. Second, we want to do this program internationally, online also. Because what I felt, and Dr. Smith, you have more experience in teaching than me, you can correct me. I think there are 3 types of students who, when they do USMLE, like when you're thinking, okay, I want to do USMLE. One, student said, you know what, I know everything. If I want to do it, I can do it. Yes, absolutely right. There is one difference, fundamental difference in USMLE exam and NEET exam. NEET exam, they will tell you, 15th of August, there will be a NEET exam. उसके बाद बम फुट जाए, लड़ाई लग जाए, whatever happen, it will be on August 15th. They will not change. And all of you will know that. भाई अगस्त 15 को टेस्ट है, पढ़ना है. डॉक्स मेरे को कॉल करो, सर प्लीज 15 को. USMLE, they let you change the date. They let you change the year. वो आधा स्मार्ट बच्चे वहीं पे गल जाते हैं. वो यार स्टार्ट करते हैं. And they do it. 2 हफ्ता करेंगे, फिर फूक निकल जाती है. फिर यार चल महीने के बाद. तो what happens is medicine is a branch. प्रॉब्लम इज वेरी वोलेटाइल, राइट? हम कुछ पढ़ते हैं, उसको अगर रिवाइज नहीं करेंगे वो निकल जाएगा दिमाग में. तो यू हैव टू कीप डूइंग इट. सो फॉर देम व्हाट वी गोना डू दिस 6-month program, Dr. Smith, I have an idea. Put a fine on that. Let's say, and I'm just bringing a number, we charging them 1 rupee. We're going to tell them if you don't do in 6 months, you have to pay 2 rupees. Double. So that they have a deadline. भाई 6 महीने में करना है मुझे, नहीं तो नहीं होगा. Second, when we study, for all of us, when we study, the graph is like this. Let's go up. Let's go up, go up, go up. Then plateau. उसके बाद वो ऊपर नहीं जाता, वो नीचे आना शुरू हो जाता है. Don't take your exam when it's going down. Take your exam when you're on the top of the plateau, right? Another thing. इससे पहले मैं भूल जाऊँ, U word. All of you know U word. U word is very important. U word is the fundamental of USMLE preparation. Never ever use U word to do your assessment. Don't do it. Lot of students do this. What happens? What they do? U word have 2,000 questions. So they do U word, 2,000 questions. Then they evaluate themselves. अभी वो क्वेश्चन याद है उनको, right? 5 बार क्यों है? अनुभव को तो 2000 में 2100 याद होंगे. अगर do that, he will score 100%, right? But now if Anubhav want to evaluate himself, he has to use another source. Problem ये है, U word वाले question pattern ठीक है सब, बढ़िया, everything is good. But the similar type of question you will also see in the your real test. But 1 or 2 words they change. Now if you focus on U word, कि भाई U word ही करना है, तो I give this example all the time. They will give you a question with same patient coming from home with pneumonia, right? तो उसके नीचे आंसर लिखा है, इसे community acquired pneumonia, answer is ceftriaxone and. अब क्या होगा? Same question. They will tell you patient coming from a nursing home. अभी वो बन गया hospital acquired pneumonia. आंसर चेंज हो गया ना? आपको नहीं, आपके दिमाग में U word भरा हुआ है. वो क्वेश्चन तो सेम ही आ गया, आपने देखना भी नहीं है तो आपने लगा देना है वो, तो फिर गलत हो जाता है. पर अगर if you know what are type of pneumonias, what are type of antibiotics we use, and what are the bacteria, तो कोई भी क्वेश्चन आ जाए यार तो कर दोगे, फिर तो कोई प्रॉब्लम ही नहीं है ना. So that's the difference between 260 and 220. People who read like that, pneumonia सारे पता है उनको, पहले तो कितने होते हैं, ठीक है ना? कम्युनिटी एक्वायर्ड, हॉस्पिटल एक्वायर्ड, वेंट एक्वायर्ड, नोजोकोमियल, कौन से बैक्टीरिया होते हैं, कौन से एंटीबायोटिक. एक बार पढ़ लोगे, लाइफ में भूलोगे नहीं, कोई क्वेश्चन गलत नहीं होगा, पढ़ो ऐसे, राइट? So that's the way to study it. ये, this is the first category of students. So for them, we have to give them a deadline. They are smart, they can do it. They can do it without us. Anyone can do it without help. I'm telling you. I did my USMLE in 4 weeks. 4 हफ्ते पढ़ा था, आप ही के नोट. But I'm not recommending that to anyone. Don't do it. Take your time. 6 months, I think, is that. Now there are some students who do need hand. They do. Lot of students who go to universities outside. I've been in Georgia. कोई पढ़ा नहीं रहा वहाँ पे. Nobody is teaching. आपको जाके पढ़ाना पड़ता है. I know that. And they are doing very good job. So nobody is teaching. Those are the students who don't have good fundamentals of medicine. उनको we need handhold. They need chapters. We need to teach them. We need to tell them about pneumonia. Not the whole book, but as you said, high yield topics. We have to teach them. And they may take more than 6 months to take this exam. So start it in your 3rd year. 3rd year shuru karo. Start in your 3rd year. You don't need to spend lot of time on it. Give 2 hours to it. Right? Give 2 hours. Do whatever you're doing with your school. But if you have a test in your school, read properly for that test. मेरी तरह फेल मत हो उसमें. स्कूल टेस्ट में बड़ा फेल हुआ मेरी, पढ़ता नहीं था मैं. पढ़ो, read it properly, because those are the fundamentals which will help you to score very well. If your fundamentals are weak, then फिर USMLE become very hard, है ना? फिर वो USMLE को रट्टा और U word को लगा के पहुंचोगे, and every question will be 1 word different. फिर फेल होता है. That's why it fails. ठीक है? So year of graduation I covered, internal medicine, family. So those are the 6 specialties I said. So एक last जो category है जिसमें हमें help करनी है बच्चों को. Some students are very good. They have done it 6 months. अभी उनको revise करना, and they need a crash course to make sure to evaluate them, accept U word. I think that's where we can help them. 1 month, very, very high yield topics. And
sir, in the opposite classroom right now, we are running a boot camp for NEET PG, 1 month course for similar students who have studied, but they need something for 1 month. So that is what we are doing, and that is what we have.
These are the 3 categories of students, and I think that's how we can help them. So next slide. So these are state-wise, how many positions and what is the percentage. Like New York, I always say that. If you ignore New York, you cannot match. This is the reason for that. 37%. और देखो number of seats, 1600 positions. 600 सीट तो न्यूयॉर्क में मिल गई, right? आप बोल रहे थे ना 600-700 बच्चा अप्लाई करता है, 600 तो न्यूयॉर्क में ही है, राइट? सो वी हैव टू अप्लाई मोर. So there is an opportunity. We can increase this, right? Pennsylvania or California was very old to IMGs back in the day. It's changing slowly. Now I have seen some students are getting in California also, but still less than New York. Okay, next. So this is what we did. When we did the study, we saw which are the states, you get the position. Those are the states we started our rotations. But right now we are mostly focused in New York. So the best rotations we have in New York, because I have control on those doctors. Sometimes it's very hard for me to control a doctor who's in Texas. चिट्ठी नहीं मिली, मैं कॉल करूंगा. यहाँ पे if you don't pick up my phone, I will pick up my car and go to his house. Texas नहीं जा सकता यार. तो वो थोड़ा we are shrinking that. So what I'm trying to do is, if you come with us, right, I want to make sure you at least get performance-based letter of recommendation, guaranteed. Until unless you did something really ridiculous that the doctor thinks you should not be a doctor, right? So then तो different है. पर हमारा मुझे नहीं लगा किसी ने अभी मुझे तक कॉल किया ऐसे. मैं सुना है कुछ डॉक्टर बोलते हैं. But so far I think it's pretty good. Next one. Acha, this is the survey. Remember I told you there is a survey. Every year it comes. This is a survey from program directors. So program directors tells us what do they look into your application when they give you interview, and what do they look into your application when they match you, right? This is little older. तो इसमें वो CS और बोल रहे थे ना clinical skill exam जब होता था, तो ये वो है. पर अब तो वो नहीं है, and step on scores. So look at this side interview में top is score. Then your dean's letter. Everyone know what is a dean's letter? MSPE, right? Very important document from your medical school. What does MSPE has? First, make sure MSPE is in a US format. US format में ही होनी चाहिए. Because if it's not, some program directors don't like it. I think Dr. Fisher did a post on it one time, right? That he hated like MSPE, which was like in different. He said, I had 10 applicants. Everybody's MSPE is in a different format. Tell your program, make it in a US format. And he actually linked it like a sample. A sample is there. So I have seen some medical schools actually, they will ask you, tell us what format you want. Because they don't have a format. So give them the format and they do it. They will make it on that. What does MSP contains? It contains all the step scores, like all the year scores, like how much you score in anatomy and physiology and medicine. And then for US students, it's more elaborate. All the rotations you have done. There are comments, like sometimes I still have some students come from, hospital there. They give me a form and they write a paragraph that write a comment for MSP. So make sure when you do your rotation, tell your doctor, sir, can you put a comment on that? Because that will go in your MSP. Like sometimes I get students. So I get students from Turkey, from Hungary, Germany. So they bring a form and that form has that. So if you are a student and tell your medical school, give you a form of evaluation. Sometimes they will say, we don't have it. It's okay. Just get an evaluation form and let your doctor fill it for you. Because that way, that will become an official document in your file, and that comment, like, like Jiskon came to me, like Anubhav came to me, I wrote in Anubhav's letter, he was the best teacher, right? So that will go in his MSP if he's a student. So those are the things which are important when you come for rotations. Not you have to go to which hospital, that hospital, John Hopkins, this and that. You're not going to get John Hopkins. I can tell you right now, right? 1 or 2 students. And that's also, I will show you the slides. Like, it's hard for a non-US IMG to match in these institutes, right? Oh, this is score. So I told you around 245. So this is from IRAS also. So our data and IRAS data is almost similar. So next. Now research. Burning question, everybody. 100 papers. Let's buy 100 papers. No need. No need to buy 100 papers. So look what IRAS tells us to match in medicine. How many posters, presentation, abstracts people did? Internal medicine, 2.8, 3 point. So who matched has 2.9. Who did not, who did not match 2.8, or like 3 or 4. That's what they want. You know why they want you to do research? Anubhav, why? I told you this. Exactly. They want you to know how to read an article and use that information to treat your patient. That is the whole idea. They don't want you to be a scientist or PhD, and they have PhDs for that, right? They just want to make sure. So that's why instead of putting 10, 15 articles in Curious, try to send your abstract. There are so many conferences now which have a student section. And out of that, they have an international medical graduate section. I saw somebody's CV came to me, so some student didn't match. And I was looking at the societies. So what societies you should be the member? You should be member of American Medical Association. Very easy. ECFMG certification you need $28. ACP, free for students, $30 for graduates. And you can become ACP member whenever you want. ACP is called American College of Physicians. So she put societies. Project IMG, and so those societies you don't put in your CV. You do work with them, it's okay. But at least your first two should be AMA and ACP. You are a member of Indian Medical Association, good. Put that. Your Indian Surgical Society, put that. But at least you should have something in America also. Because a lot of students ask me this question. I have done research in my country. Should I hide it or should I put it in? You should put it in. It's okay. But then do I have to do more in US? I said, where you want job now? You worked in India, but you want a job in US now. So you have to show them that I was capable of doing it in India. Now I'm capable of doing it in US. Just how difficult was it to, how many abstract went from you in AMA? Yeah. 20, right? It looks very difficult. Anubhav, how many you got? So, right? All of them got accepted, right? And it looks so hard. You guys didn't believe me in the beginning, right? When I said it will be done. They were like, how this, I was telling them, it will be done. Just keep doing it. All of them got accepted. All of them. So that kind of research is more than enough. And that research is merit-based. AMA, you send it. They get 8,000. When they send it to Soho, so I got an email from them. They got 8,000 abstracts. They pick up 200 for presentation. And out of them, 92 was cutting edge research. And 2 of those were there. Cutting edge research. They did amazing job on multiple myeloma. We have a lot of multiple myeloma patients because I treat a lot of African Americans. They have a lot of myeloma. So we have a lot of patients with them. And they did very good job in analyzing the data. Yep. So this is research. Next. Volunteer experience. Volunteership is very important for Americans. They love it. But don't make up stuff again here, right? I saw a CV 3 years ago. Somebody sent me a CV. So this he didn't match. So I'm looking at the CV. So he is like part of like 5 associations for volunteership. And when you write your CV, you have to put your CV year-wise, like what I did in 2001, 2, 3, 4, 5. So 3 times. So he's doing a rotation in US, and then he's a member of this volunteer group working in India. I'm like, how are you present in 2 continents at one time, right? So when PD is looking at the application, he's confused now. Like, right? That thing in the mind, is it false? Is this application false? So he said, no, sir. I was doing it, but I then went there. I said, then just write down, na. You did volunteer from September 2011 to December 2011. In January 2012, you went for a rotation. Finish, na. Keep it clear. Has to be clear. Same thing with the visas also, interviews, right? I will go over on those things. Next. How to get best letter of recommendation when you guys. This is, everyone asks me this question. Everyone. It does not depend on the doctor. Now, hospital rotation, biggest problem. You sometimes don't get letters. Very hard. Because they don't have any commitment to you. Hospital send you to a doctor. That doctor may or may not give you a letter. Second, you may not work with Sumit, same doctor, right? Sometimes you work with 4 doctors in a month. So that doctor said, Sumit, I have seen you only 2 days. I'm not comfortable giving you that. So what you should do, at least do 3 rotations where you have a guaranteed letter on your performance, at least 3, because that's the requirement. And you, after that, those 3 get, then do million more if you have money. Go wherever you want to go, right? Because then you do that rotation, and if you don't get letter, at least in September, you will not run to us. Maximum students come to us in September. Now because they don't have letters. And then they will tell me, September's last date is September 10. They join September 8. 9 o'clock they join. 9:15 they ask me, can I get a letter? I'm like, who are you? You know, it gets very hard at that point. So prepare in advance. Keep these things in mind. I need 3 letters. And those letters should be in July. Now, you asked me about this number of students, right? I came in December, I had 2 students. 2. November, I have 1, right? And I keep begging students, if you want to have access to me with less students, come to me in November, December, January. Nobody will come. Everybody will come June, July, August, September. Then I will get phone call from the Chief Minister of my state. Sir, please, ek ko to le lo. Like, everyone is busy at that time, right? As you said. So July mein, you know, no, hospitals are busy. Half of the medical schools have holidays. Students want to come in July, right? So the best time, if you want to have less students during your rotations, do it November, December, January, February, 4 months. I know it's cold in America. It's okay. Buy a thick jacket. There's a lot of jackets in Macy on sale. Buy one and come and go. Because then you will see more patients, there will be less crowd, and you will have more time with the physician. Okay? So those are the months. But if you do that January, July, August, September, you have to deal with a lot of things. There is no way. But Dr. Srinivasan, as I said, so what we did is to make the experience better. So we made 9 exam rooms. Because we have a lot of patients. 9 exam rooms, and we give it to 1 student. So they are in that room with the patient. So they see like 3, 4, or 5. And I think for a medical student, 3, 4 patients or 5 patients a day is more than enough if you see them properly. You write, focus on their notes, read the notes, and then ask questions. More than enough. You will learn the system. Okay. Now, let it. Important. So, if I tell you on the day 1, I very clearly, I do an orientation online with all my students. I tell them what I like and what I don't like, very clearly. I don't like if I go to your room and I tell you, patient, you're like, I saw 3 already. I hate that. You paid me, right? You took a flight from India, 14-hour flight, and spent so much your dad's money, and now you're telling me, I saw 3 patients, I can't see 4th one. I hate that. So don't do that. Reach there on time. Okay, thank you. So, there are 16 days in a month you have to work with, right? Show up for those 16 days. I got a student come next day, sir, I got diarrhea. I'm like, so, you know, so diarrhea is, I know, because I've been there. No? I had made these excuses a lot of times. Diarrhea was number 1 excuse not to go to school, right? So I know you don't have diarrhea. So if you want to come for excuse, make a good one, right? New York, traffic, sometime you're late. Inform us or inform your doctor, I'm running late. Because we have given you some jobs, right? We have given you some jobs. And if you don't show up, the whole clinic is now on hold because of you. And we hate that. So be punctual, come on time. Be respectful to the patients, to the staff also. Sometimes people are so nice to me, they're nasty to my staff. I'm like, why you do that? Why you do that? Because I am writing a letter for you, telling a program director that student is amazing. He will be an asset to your program. And you are fighting with the whole hospital when go there. He will not take any student from me next year, right? So at least show me your best part for 4 weeks, not more than that. Whatever you are in your life, those 4, behave in those 4 weeks when you are doing rotation. Right? It will be frustrating sometimes. Patient will come, they will tell you, I don't want to see you. I want to see Dr. T, right? Sometimes they say. Don't argue. Come out of the room. Tell me, this patient don't want. Then I will take you with me, and they will be okay after that, right? Don't start fighting. Sometimes I get some students from Turkey. Turkey people are very hot-headed. Some boys especially. You know, oh, they are from that mammoth, you know, generation. So he's like so mad with the patient. I mean, it's okay. Don't mad. You are not in that position to be mad with the patient. If patient says, don't want to see you, tell them, okay, don't worry. Come out of the room. It's all right. I will go with you. So you have to handle your rotation like. If I tell you, do a presentation. Do the presentation. Don't, if you want to change, let me know week before. Because we have that tight schedule, right? And it takes so much time to arrange those, right? And that day in the morning, I cannot do it. I hate that. I hate it. Either tell me I'm not going to do it, I'm okay with it. Don't tell me that I will do it this day and I'm ready, I come and I sit on it and there's no presentation. So these are some of the things don't do, right? If you do these things nicely, you will get the best letter. Letter does not depend on me, Dr. Sumer or anyone. Letter depends on you guys. Whatever you guys. So I always say day one, Khillan, show me the best things in you so that I can put all those good things on the letter. Don't show me a single bad thing so I don't put it on the letter. Right? So try to show me your best part for those 4 weeks. Okay. What is that? Because I always tell you. Okay. So how much time I have? Can I go 30 more minutes? Yeah. So now the question is, why you have to do US clinical experience, right? You can like, you guys are MBBS already, you are same degree as US students, maybe a little bit more time. Why they put US clinical? Reason? Medical education is very different in US and other countries, including, so I will tell you the students who come to me, so I know. India, Pakistan, Turkey, even some of these Caribbean universities and Georgia or Hungary. US medical education is clinical based from day one. So the kids are a little bit older than you because they have to do 4 years of undergrad. So like we go 17 in medical school, they are like 20, 21. So they're more mature. They learn faster. They start seeing patients year 1. First year, they start seeing patients. Second year, more. Third year, more. Fourth year is all on the floor for them. So they know everything about the patient. They know about everything, right? Just Karan, what is 4x4? Huh? What is 4x4? If a patient asks you, Doc, I need 4x4, what you give them? You don't know, right, what 4x4 is? Yeah, you don't, because the system sometimes is different. 4x4 is a gauze piece. They call it 4x4, right? Now, it's a gauze piece. The reason somebody asked me, he said, I'm intern first week. This guy, because they know that new interns come, they abuse you first month. Patients, some of them, chronic patients. Doc, I need 4x4. I don't know what is 4x4. So I'm like, you don't know 4x4. Who made you doctor? I felt bad, like, I did not know what 4x4 is. I went to the nurse. Nurse said, that's it. So, this is so, they know the system. They know the terminology. They know the accent. They know how to. We don't, right? So that's when the AMA and everybody, they thought, you guys are very good in testing. No one can beat us in testing. We are the best. Because we read books in medical. We don't go to hospital to see patients because there is no structured program in India. I've been there. I remember. Every clinical in third year, we used to go to canteen. Boys sit this side, girls sit some boys sit with the boys, girls, like, you know, like depending on how, how smart you are. So, nobody go to this. Third year, final year, some people do. Internship, yes. Internship, you do something. But these students are doing it from first year, second year, third year. That's why they put US clinical experience as not a requirement, but they will prefer it if you have. So having US based clinical experience is crucial to scaling a position, and it's getting more and more important now. They feel like the students who have done it here, I have 2 actually program directors who I wanted them to come, but it's like really 5 AM in US. So next time, so they will actually tell you guys the difference in students who have done it and students who have not done it. How challenging is it to train somebody for a residency? It takes them 6 months. But students who have done the rotations already, they know the system. That's why they prefer it. So if you wish to train at a US-based ACGME accredited institution, you should begin your preparation by learning more about the rigors and challenges of medicine in US. The only way to do that is doing clinical rotations, clerkships, observerships in US-based clinical sites, where preceptors can help you adjust to the differences that residency program directors will expect you to be able to navigate. So it is actually more important than your scores also. And now, always students ask me, how PD will know I have done? So they will ask you questions. They will ask you questions. Like, I have a student, so the PD, CMO of the hospital took interview, Chief Medical Officer took interview. Ask her this question. If I give you power to change one thing in this healthcare system, what will you do? Right? So if you have not worked in US or you have not done your rotation properly, you will not be able to answer this question, right? But she had worked. She was working in the myeloma team. So she's like, sometimes I have these cancer patients, and she was like, taking the authorizations and all that. That's a headache in the US. And it takes like so much time to get the medication, especially in cancer patients. And I wish I don't have to do that. So you got maths.
So that's a very valid point. I had a junior, she got matched in radiology in America, and she had a similar question that what would you want to, she did her rotations in radiology. So what would you want to change? And she said communication, and that radiology should communicate more. And that time that wave of communication that radiology should communicate was going on. And it clicked, and she got radiology.
Communication skills, so important. That's the whole idea of doing rotation and all this. Okay, next. Okay, we're gonna run it very quick because this is also a long slide. So this is the whole pathway you have to do. Don't get tired. As I said, it's long, but it's not hard. But you have to do things properly. Okay. Step 1, step 2, OET, ECFMG certification. So for ECFMG certification, you need step 1, step 2 OET, and you have to be graduate from your school. Then you will get the certificate. Next. Then comes the application. So your application is not complete if you're not ECFMG certified. There are so many students, their application get completed by like 2-3 days late. They don't get interviews. So if that happens to you, I always say, I know it feels bad when we don't match first. But sometimes it's not that you're bad, you did not match. I always say, bad luck, not enough information, and sometimes your application is not complete. Okay, next. When you will do rotations, right? Now, it depends on different people. I have some students who come to do rotation with me when they are medical students, like 3rd year or 4th year, who are really serious. They're like, we want to do USMLE. So they come in 3rd year. So they will work with me for a month. And why it benefit them? They come, they have just Karan there, Anubhav there, Harsh there, Kishan there. Everyone is different part of their life in medical school. Somebody is in 4th year, somebody is a graduate, somebody has applied 1 year, somebody did not match 1 year, right? Now you speak with all of them. And everyone give you information about the process. And if you are smart, you take that information and you go for that preparation with full force. That's where it matters. Second, when you are in medical school, it's easy to get visa. When you're in medical school and you go to an embassy officer, you ask for visa, he know that you will come back to finish your degree. He know that. He know that nobody will just leave the medical degree. When you become an unemployed doctor in India, when you're a graduate, then they know you may not come back. So I will always recommend, if you want to do USMLE, that's why it's very important to do a lot of things when you're a student. At least apply for a visa. As Dr. Smith said, you may or may not use that visa, it's okay. But you have it. You don't need to get visa afterwards and then you don't get it. Now the time is to do rotation next month and they refuse your visa. You are stuck for 6 months. That can cost you 1 full year.
I wasted like 1 year, whole year, because my visa got rejected. I was done with USMLE step 1, step 2, OET, I was certified, I was about to match, visa got rejected because I wanted to do the rotations. And then 2-time rejection cost me a whole year. And then I got the visa for step 3 exam later on, and then I did the rotation and all. So the visa rejection part is very important.
Hard and some time to get again. So try to get visa when you're a student. Okay. And when you go for visa, also make sure, now these embassy officers, what I said in US, honest and clear. Do not show them things like, if they ask you, have you booked a rotation? So I have a student, she did not, her visa don't get approved. So I said, tell me exactly how it happened. She said, this is how it happened. He asked me, have you paid for the rotation? And she has paid. She has the receipt, not with her. He said, show me the receipt. She's like, she's now looking on her phone. And she couldn't find it. Got rejected. So you should have the paper in your hand. You should have rotation fee, housing, your bank statement, your degree from your medical school, everything you should have in your hand. They may not ask any of that. So it's okay. You should have like a thick file. When you enter the visa officer, right, with a big pile of papers, half of your visa is approved right there. He knows that you are prepared. Second, guys, please go with a suit and a tie, even if it's very hot, okay? In US, we don't wear suit because it's cold. We wear suit because it's professional. I have a student who worked with me. He got matched. Stupid guy went for his interview and didn't wear suit. And he made a slide for me where he wrote by his own hands, when you go to visa officer, wear a suit. I'm like, why do it? He's like, it was so hot. That doesn't matter, okay? Be very professional. Look, we're doctors, right? I know we want to look like actors, but we can't. We have to look like doctors, right? Make sure your hair is good, groomed, well, shaved. These things are very important, especially in America. All of us, whatever face we bring, God gave us, we cannot change that. But we can have a nice hairstyle, we can have nice grooming, we can take shower, use lot of perfume and all that. Doctors, you know this thing going on the. We are from a hot tropical country. We sweat and we smell. So there are ways to prevent it. So use that. Buy a lot of cologne, and wear it as much as. When we are here, we don't feel it somehow. Whenever I come to India, I don't feel it. When I'm in US, I think it's ventilation problem also. Buildings are closed. There is no ventilation in our. We have windows open and all that. Over there, it's like stinks sometimes. For me also, like I can go in the room with the patient. Like some students come, they're like running and it's hot outside, So we have to be very, very sensitive about our perception over there, right? I don't want to hear the Indian people smell. Okay, please. When you go, buy a bunch of perfumes and things like that. Okay. Oh, one more thing. Please do not wear a shirt second day in US. So when we wear a shirt sometimes, and we wear next day in India, right? It smells. So put it in a laundry. Over there, so Jaskaran, Hardik, and Hitesh, buy 7, dress for 7 days. Okay, 7 days. You should have ready. Dress for 7 days. 1, 2, 3, 4, 5, 6. 7th day, you're gonna get only 1 day off to do laundry. You cannot do laundry during the day, during the week, I'm telling you. So that is another thing. So that we tell them in intern survival drill. You should have, including 7 underwears. Okay, you will not be able to wash them. So when you become an intern, you can only work, and the last day is for shopping and laundry. That's it. So that is the intern life in nutshell. Okay, so do that. So when you're doing application, one of the most important things and most challenging thing for non-US student is application, because we never written an essay on us. We always written essay on our friend and our father and Gandhiji, right? Nobody told Anubhav to write an essay on him, right? Nobody told Jaskaran to write an essay on him. And now he has to write an essay on him to sell himself. And that doesn't, our culture. It's not our culture. It's not Indian culture. We don't feel like bragging about things. And especially for girls. Girls, तो अरे लड़कियों हंस रही ऊंची ऊंची मत हंसो बोलती है ना old ladies, right? I still remember. So, but it's not there. When girls come to me, sometimes they don't talk. They don't answer. Not they don't know the answers. They just, it's culture, right? Pakistan, same thing. American people feel that you are less smart. So we have to break that. Talk, yaar, shor machao, khoob uddad machao. It's okay. Live your life. That's what American likes. They are very passionate people. Very passionate. हर चीज में गेम खेलेंगे full passionate. My son was 4-year-old. तो उसको फुटबॉल क्लब में डाल दिया. अभी मैं कहा ठीक है. तो वो एक सामान की लिस्ट आई. 6 balls, 6 footballs, different sizes. Shoes वो होते हैं वो spike वाले. पूरा dress. मैं गया. There was like in the morning time. एक तो 6 बजे उठ के मुझे जाना पड़ा weekend पे. So there was like around 100 students, little kids playing. You know how many footballs they had? Doctor, I'm not making it. 500 footballs. मैंने बोला हमारे गांव में एक होती थी उस पर पंचर लगा होता था और पूरा मेरा मोहल्ला खेलता था उससे, राइट? और कई बार वो नहीं मिलती थी बॉल क्रिकेट खेलने के लिए. पता क्या करते थे? अभी गरीबी की हद दिखाता हूँ. वो कागज उठाते थे, कागज को गोल करते थे, उसके ऊपर पॉलीथीन का पेपर, उसको रैप करते थे, वो बन गई. अब बैट नहीं है तो कापी होती थी, कापी, उससे क्रिकेट चलता था, राइट? तो हाउ आवर फुटबॉल टीम कैन कम्पीट विद यूएस फुटबॉल टीम? यार फैसिलिटी देखो ना. 4 साल का बच्चा 5 बॉलों से खेल रहा है वो, राइट? हमारा यहाँ 5 साल वाले को तो पता भी नहीं फुटबॉल क्या होती है. जब खेलने लगते हैं तो सो इट्स वेरी डिफिकल्ट. सो दे डू एवरीथिंग. साले मारते भी पैशन से. देखा ईरान का क्या हाल किया हुआ है, मार के मिसाइलें, हर चीज पैशन से करते हैं. उनको जो भी एक बार कर लिया ना, तो वी हैव टू शो दैट पैशन टू देम कि भाई मैं अगर आ गया ना आपके प्रोग्राम में तो यू विल बी वेरी हैप्पी. दिस इज द मैसेज यू हैव टू गिव टू द प्रोग्राम. कई बार मैं देखता हूँ वो इंटरव्यू में बैठते हैं बच्चे, मैं थोड़ा ट्रेन करता हूँ इंटरव्यू के लिए, वो डरे बैठे होते हैं. अरे मैं मुझसे क्यों डर रहा है यार, मैंने तो कुछ भी नहीं देना तुझे, ना ही कुछ लेना है. मैं तो आई एम जस्ट टेलिंग यू, राइट? एटलीस्ट यू शुड बी वेरी कॉन्फिडेंट. ठीक है? लड़कियां इससे आंसर करेंगी मुझे. अभी मैं यार तुम मेरी आंखों में आंखें डाल के देख तो सही, आंसर तो कर. यू शुड लुक इनटू द आई. बिल्कुल लेवल ठीक होना चाहिए. कॉन्फिडेंस से आंसर करो यार, इट्स ओके. तो लड़कियों के लिए वेरी वेरी इंपॉर्टेंट, व्हेन यू आर देयर बी कॉन्फिडेंट, आंसर. आप लोग स्मार्ट हो, इन सब लड़कों से स्मार्ट हो आप, राइट? बट प्रूव इट. यू हैव टू प्रूव. ठीक है? पर्सनल स्टेटमेंट. तो मुझे पर्सनल स्टेटमेंट पे आई हैव टू चेंज माय लेक्चर इन लास्ट 3 years. 3 years ago I used to tell people this is how you do personal statement. You start writing your personal statement. Please write yourself. Don't let anybody else write you, because you are the only person who know about yourself, nobody else. Don't tell me to write your personal statement. I don't know about you, right? So when you write it, now English is not our first language, right? So the way we will write it, keep reading it every day for 30 days. Seriously bol raha hu. You have to spend 1 or 2 hours. Write it. Everything about you. Where were you born? What did you do? Why you become a doctor? What were the challenges in it, right? Or what was the point where you made a decision in your life that you want to do internal medicine? Huh? Do not start your LOR by killing your grandparents. Dadi mar gayi, dada mar gaya. Please don't do that. Don't start that. Start it with a cheering note. है ना? खुशी खुशी. और उसके बाद you guys can take help from AI. लिखा हुआ है NRM, very clear. But content should be original yours. Grammar you can do, and you can tell them write it in American English. There's nothing wrong in that. है ना? English is not our first language. We write English with different. And make sure when you use AI, it should not look that it is written by a machine. Sometimes it happens. So you have to give commands properly. So I did the command, and the personal statement it created for me, I am really impressed. It's on our website, by the way. You can don't copy that, okay? It created such a good personal statement for me. I just wrote what I did. कहाँ मैं पैदा हुआ, कहाँ गया मेडिकल स्कूल, क्या challenges से, कहाँ research करी. That's it. And I told them make a personal statement for internal medicine, and also you have to give like very proper cue to it. You cannot just say write personal statement. You have to say personal statement for internal medicine residency. And now, before I used to say 3 years ago, show it to an American person, either an American medical student or at least somebody who born in America. Now, Grok, ChatGPT, all these people are very good. So you can show it to them. So they will tell you, right? Then comes the application part. So one, you have to do your essay on you, and then you have to do 10 more essays, 10 experiences you have to write. And one of them should be meaningful. Three meaningful. 3 should be meaningful, and 1 should be most impactful. Right? So not only they make it complicated, you have to write 10, you have to write 3 most meaningful and 1 most impactful. And there are guidelines for every paragraph. That if you're writing this paragraph, what part of medical education actually help you, right? We look at that. Is it a teaching? Is it clinical work? Is it research? So make sure that matches. Sometimes we see the application, people write research and then they write rotation. If you're writing rotation and you learn clinical experience, put it in clinical experience. And sometimes do clinical rotation, right? And then you learn about low socioeconomic status people, you learn about health inequalities, then put that in health inequalities, right? So you have to do each of that essays. So it takes time, right? So start the process early. Don't wait until the last, like, okay, it's okay, I will do it. Because I'm telling you, this takes time, and the better your application is written, the more chances. All right? So, as I said yesterday, doctor, 90% system is fair. 10% connections things work. But 90%, if you work hard, you will match without any connection. I am your connection, right? Networking, people ask networking, right? What is networking? Now all these kids, I called Hitesh, he matched. I had a student, I'm like, Hitesh, yaar, ask your PD, can he give an interview? Hitesh went, and he got an interview, right? But that's the only thing we can do for you. After that, you're on your own. Hitesh cannot tell the program director, can take this guy, or I can even. That decision is program directors, because he will see, are you capable of working in his program? And you have to prove that. And if you prove that, 1 interview and you match, right?
So usually program ask the interns or first year, second year, third year that if you have anyone in mind, you can recommend to us like 3 or 5 students, so they can, it will be easy for them that you already saw that person, they're good at it, so they can review their applications. So they give offer to everyone. Like if you want to suggest someone, 3 or 5 students, so that's how networking works. So I gave 3 names, like, okay, these are my 3 top favorite candidates who are good at it, good at everything. I already saw them, so I recommend them. I gave their application number to the program director, and then they review. Doesn't matter if they're gonna give interview or not, but at least they will review their application for sure. And that's how networking works. So at Brooklyn USC, like we have like 1,500 like different doctors in different hospitals, and we do, because of the networking, that everyone get interviews. Like doctor called me, like, and we usually recommend those students who are really good at it. Like I don't want to recommend someone else who I never met, I never worked with, and he's not good, because next time the program director or program coordinator not gonna listen to me because that guy was not good at all. So you have to be good.
My whole presentation. That was my next slide. Thank you. So then after that, if you can, come to US, guys, if you can afford it, because people who stays in US get more interviews, and you know it's very important to be there, especially when you're in SOAP and other things. Just think about, I always say that, think like a program director when you're interviewing somebody. There is a student in India and you are interviewing that person, and there's a student sitting in New York interviewing, right? Who you will take? Like if their application is same and everything. What will come in your mind? that this guy is already here. He has a visa. The other person is still in India, right? I don't know if he came here or not. He did a rotation. This, just Karan said, I'm working here. You were in the US, right? During that. So I always say, during interview season, stay there. Before I used to say 5 months, 5.5. Now I say 4.5 because they also check that during your J1. So spend 4 months, 4.5 months. Do not extend your stay at all. If you have 6 month visa, there is an option to extend. They don't then give you J1 later on. Do not extend. Come back a month before. All right. So these are very important things. Okay. Interviews and networking. Thank you. So I don't have to say that. So that is networking. You need to know. Make friends. Okay. Make friends so that they can vouch for you. And make sure they know how you work. Sometimes, you know, people, so we have some inpatient rotations also. I send some students who are very good to some hospitals also. So sometimes I tell them, it can be a double-edged weapon. Right? When you're in the hospital, where there's a chance you may match, they may know real of you. So make sure you are good. Because if they know real of you and you're not good, then it's gone. Then the whole process is gone. Right? So, and then you match. Right? So what I want is, before we go, oh, one more thing, this is important. No. That circle, press 1, enter. Why circle is not working? Okay. So this is the trap. This is the trap. Trap is, if you don't match 1 year, don't do MPH. Don't go to do MPH. Don't go to Mayo research, things like that. This is what happened with the research. You know who should do research? People, like I have a student, he's my best friend. His name is Baha, he's from Turkey. He came to me. Excellent scores, 259. Full of energy, more than me. He told me, Dr. Khillan, I'm not going to apply this year. I have applied for green card. I'm going to get my green card next year. And I want to do residency in Yale. I'm going to do research. I'm going to produce 100 papers. He did. He produced 100 papers. He produced 100 papers and he matched in Yale. So that's the person who should do research, right? Now, who should not do research? Sometimes you don't score very well and you don't match because of that. And then you're like, okay, let me do this research. Now, when you do this research, if you are not good, and it takes a lot to do research, because the person you're doing research is a very renowned, established person. He has done a lot of good things for his life, and he's set for his life. They are mostly tenured professors. It's a very slow process of research. You go in, you do. You will not get residency in Mayo Clinic. You will get residency in a small community program. Now, that community program know that by doing that 1 or 2 year research in Mayo, now you become very lazy. Because research is lazy. It's not no activity, no clinical work. Medicine is action. People are dying left and right. Somebody code here, we have to, somebody have a cardiac arrest, we have to do code right here. That action is not in research. So you become very slow. In code also you will run slow, right? When you have to run fast at that time. So program directors don't like that mentality. And then you have seen Mayo Clinic. Now this little community program, you will hate it. 3 years you will curse the program director, the program faculty, everyone, because you think I came from Mayo. Where you are not doing anything in Mayo. You were just trying to get position. You should thank that program. One more thing, when you match, thank that program. That thank you so much. And thank God that you match, because this is the biggest achievement of your life. It's a life-changing moment. Ask people who did not match first year how they feel. How they feel. So thank. Okay. All right. So I think now what we should do is, let's start from Jaskaran. I have these students who match and they worked with me and they were my best students. What I want them, Jaskaran, Hardik and Hitesh, what I want you guys to, like Jaskaran when you came first time, Jaskaran did not match first year. And whatever he did second year also, he did. I just did some guidance. I just want to tell you, what is our contribution?
So first of all, hi everyone. My name is Jaskaran Singh. I'm from GMC Patiala, the same college from which Dr. Khillan graduated. So first year match नहीं हुआ, so obviously it was very shocking. I was expecting it, and I gave it all. I gave my step 3 just 2 months after my step 2, and it was there before applying for my application in September. So I didn't match. I saw a link over his page. I put my credentials and all my CV, and I just received a call from nowhere, and मैंने सर ने मेरे से पूछी मेरी कि क्या आपकी प्रोफाइल है, एंड ही जस्ट टोल्ड मी वन थिंग, यू आर गोना मैच नो मैटर व्हाट, जो भी आपकी प्रोफाइल है उसमें मेरा रोल रहे ना रहे, आप मेरे पास आओ चाहे ना आओ, पर आप मैच होगे. सो वो कॉन्फिडेंस सबसे पहले एक बूस्टर था एट दैट पॉइंट ऑफ टाइम वेयर आई वाज एट द लोएस्ट पार्ट ऑफ माई जर्नी. सो मैं उधर गया. सो फर्स्ट ईयर में क्या डिफरेंस था, देयर वाज नो गाइडेंस, देयर वाज नो मेंटर. So I was just taking guidance from like 20 applicants who are there at my rotation. कोई कुछ बता रहा है, कोई कुछ बता रहा है. Maybe that is a good thing for him, जो भी वो कर रहा है. But that is not suitable for my particular application. So that's where Brooklyn Yuski and Dr. Khillan played a role. They guided me at each and every part of my journey. Like how there are boot camps, PDs come there, they guide you. There are applicants from previous math cycles who are already resident over there, so they guide you what they did differently and what you can do this year. So हमने each and every step पे application पे काम किया हमने with J. So with research also, I had no idea how to do research. Like I hated research. मुझे था क्या यार मैं क्यों कर रहा हूँ, मुझे बस रेजिडेंस चाहिए, मुझे काम करना है. तो we started research paper. He said research करते हैं. I was like I had no idea how to do it. So he was like start करते हैं. I will guide you guys. तो हमने एक से start किया था, and then I used to see the papers and all the data from the patients over there. I used to go on Fridays, Saturdays and Sundays. जो ऑफ होता था, सर ने हमें चाबी दी हुई थी, जाओ डाटा देखो और जो भी आपको लगता है फ्री विल थी. सो 4-5 जाने थे हम, तो हम देखते थे कि क्या हम डिफरेंट म्यूटेशन निकाल सकते हैं, व्हाट डिफरेंट इज देयर इन दिस पर्टिकुलर केस. तो हम जब भी जाते रहे कहते थे, हम पूछते थे कि सर ये कुछ डिफरेंट लग रहा है, तो इसमें क्या हो सकता है. कहते कुछ नहीं, करो लिखो देखो इसमें क्या हो सकता है. देन वी यूज्ड टू प्रिपेयर एंड वी यूज्ड टू सिट इन हिज रूम and we used to go to Dunkin's and we used to discuss over there. So like it was completely different.
Dunkin famous है.
Yeah, it is very famous. So वो एक environment होता है, आपको मिलता है, and I think most important is mentorship और guidance जो आपको मिलती है. Like एक है कि आप एक घोड़े को रेस में दौड़ा रहे हो, लेकिन घोड़े की नज़र इधर भी जा रही है उधर भी जा रही है, वो नहीं सीधा भाग सकता. तो डॉक्टर खिलन इज लाइक, जो वो आँख होती है ना, घोड़े की आंखों के साइड पे होता है कि आपको सीधा दिख रहा है, दैट इज योर वे, नाउ यू हैव टू पुट इन ऑल योर एफर्ट, एंड दैट्स व्हाट वी डिड डिफरेंटली इन माय सेकंड ईयर. आई कैन टेल यू अबाउट माय जर्नी. सो वो डिफरेंट था मेरी सेकंड ईयर में, एंड दैट्स ऑल, एंड आई एम हियर. थैंक यू सो मच डॉक्टर खिलन फॉर ऑल द सपोर्ट.
पर मेहनत इसने करी. हाँ, मेहनत इसने करी. अच्छा, we have another student, Subhav. Subhav also worked with us for more than 6 months. He also played an important role, not only in his success, in other people's success. सबको इकट्ठे cohesive 100 people he was managing, right? And around 20 American Medical Association. 20 got accepted. Every other poster was from Brooklyn USA this year. Every other poster. So Subhav is in Armenia right now. He just got married, but so he matched. So he said, you know, I want to. He's from Dallas. तो उसकी फ्लाइट थोड़ी डिले हो गई, नहीं तो he was supposed to. तो सुबह will. सुबह अभी चुप कर यार. You are not on yet. Tell Subhav, wait for 2 seconds. Subhav, I will tell you when to start. In the meantime, any questions? कुछ फायदा हुआ? सीखा कुछ? पक्का? Not to make me happy. Okay. Oh, question. You have it? Okay.
So what are the pros and cons of community programs versus university programs?
So,
Except fellowships.
Right. So one of the biggest thing is, of course, the fellowship. If you want to do cardiology and your program does not have cardiology, then it becomes a little challenging for you to do cardiology. But still there are ways. So what students do, they do the job in the hospitals which have cardiology or other things, and they get it. Again, you have to have wish.
So
Other than that,
in terms of residency training, because in America there is ACFMG accredited training, universally
audible and visible.
That's why I'm asking.
Okay. Yeah, that's where I was actually coming.
Okay.
So
I cannot see you, so I hope you all can see me on the screen. Right?
Yes, Subha, we can see you. Can you hear us?
No. So everyone can see me and hear me, I'm assuming. Okay. So hi everyone. Thank you, Dr. Khillan, for the opportunity, and also Dr. Sethi for being there and organizing all of this. I had to be there. I'm actually from Delhi, but because of these recent events, my flight got cancelled. So I had to reschedule it and I could not reach on time. So a little bit about me. I'm sure Dr. Khillan has explained you everything about the process. I do not know, I cannot add much because he's the expert there, but I can tell you about my experience, so maybe that will help you gain some insight. So I was I'm always a student who's always dedicated, but even with that, even with trying everything, I did not match in my first cycle, which was last year, to be completely transparent and honest. And I did not give up. I believed in myself, and I went to the US again, and again to Dr. Khillan. I held his hand like a father figure, like a mentor to me, and together we achieved, I feel, great things. He already talked to you about the research. We did a lot of research there. I personally gained a lot of experience. I saw amazing cases in the clinic, and it felt like a mini residency for me. Now I have not started my residency yet. I'm yet to start this year, but it felt like a mini residency because it started with like pre-rounding on the patients, getting the patients list, or giving lectures, which can be as a morning report in residency. So I think it was a perfect, package to get ready before residency, and that experience reflected in my application. That experience was shown in my personal statement. That experience was shown in my CV. So I believe the program directors or the programs could look through it that yes, this is genuine. This person really, submitted these many abstracts in these many conferences, really helped, collaborated with other team members, like just Karan told you now, that we worked on many researches. So genuinity matters. Okay, so I would say, if you're coming to Dr. Khillan, you can expect to achieve great heights, but you are expected to work hard. Like he said, he does not like people if you tell him that I've already seen 3 patients. He has to see every patient in every room. Okay, so if we are spending our money going there to Dr. Khillan, so I would say, if we work hard and like just Karan did, I believe I did, I think no one can, stop us from matching. So even I went unmatched last year. Uh, I matched. Obviously, on top of that, you need good scores. So that should still be the primary focus because that's the filter. But once your scores are done, uh, this is the best way. Hard work, and hard work will always lead to success. Of course, there is always a little bit luck factor, but hard work will increase your chances of luck as well. So if you guys have any questions about the whole process, how are the rotations, how's the research, I'll be happy to answer. And once again, thank you to Dr. Khillan and thank you to Dr. Sethi for organizing this. And I'm really happy to be here. I cannot hear any of you guys though.
Get see if Akhilesh is ready. What is time there in New York? Hardik, come. So first tell Subhav, like, thank you. So Hardik is from DMC, and when he came to me, his dad is my batch. So he said, I want to do psychiatry. I said, I'm a medical doctor. So, but when he came, so we were able to get a psychiatry rotation. And, but one thing he told me, he said, first month I want to work with you. So I'm like, okay. So because psychiatry, you have to do medicine also. You guys know that, right? The prelim, like in neurology, you have to do a year of medicine. So Hardik was there with us, and he worked with the psych team for a month. And one thing I liked about him is, whenever I meet him, like I think in 3 months he was with me, and I met him like at least 10, 20 times. And every time I ask him, Hardik, how are you doing? Said, I'm good. Sir, I'm going to match. Such positive energy every time. And when he got this interview, so I called him. I said, how did interview go? He said, I'm going to match. So I was a little scared, like one interview, but he was confident. And I don't know how he did it. He will tell you.
So first of all, thank you so much, Dr. Khillan, for giving me an opportunity to stand in front of you all and share my insights, my views. So before sharing your contribution, Dr. Khillan, if you give me permission, I could like share my views on how to. Dr. Khillan has already shared all the technical stuff, right? So me being an upcoming psych resident, I would like to share 3 behavioral aspects which I think any resident needs to have, and it will give you 100% success rate. 100% success rate, I'm sure. I call it the GEO formula, not the Geo Hotstar, the GIO. First one, God. You cannot do it without God. When it's your time to win, you cannot lose. And when it's your time to win, it's not determined by me, not determined by him, not the best-selling author, not any social guru, not any spiritual guru, but only by God. So trust me, prayer can work wonders. I have seen it, tried, tested, succeeded. Second thing, the I, intent. It's very important to have a pure intent when you're coming to the US, whether for your rotations, for your research, or for anything like that. You need to have a pure intent. And when you show that thing in your interviews, in your rotation, your boss sees that. You have that aura when you work over there, right? The last and the most important thing is, obsession. Like, ask yourself, are you actually obsessed with your work? Like, when I came to the US for the first time, my dad asked me, okay, so you're going to Dr. Khillan, right? I said, yes. Okay, so he asked, what's the first thing that comes out of your mouth if he asks you, Hardik, you have to work for 48 hours straight, no food, no sleep, no rest. What's the first thing you say? And I said, sir, ho jayega. Will be done. Like, if you actually love your job, like I love psych, I love psychiatry. I was obsessed with working with psych. So I just had one interview. I know that I called out to Khillan. I told him that, sir, I have one interview for the cycle and I'm kind of anxiety. I was anxious. So he said just one word, Hardik, either do or die. So I had a list of questions. I had left for like 50 questions, which you usually ask in the interviews, right? And I had 10,000 answers to those interviews questions. And I improvised those 10,000 answers again and again and again and again. And as far as because my in-person was an in-person interview, and in order to excel the in-person interview, to watch UPSC mock interviews, which like really helped me. For example, the first which when you enter the room, the first thing your PD says, did you open the buttons of your coat when you're sitting down? How did you stand? Like, for example, so you are the PD. So a student comes up to you and he shakes his hand like this. The second student comes up to you and shakes his hand like this. Whom would you match? First one or the second one? Yeah, the moment you make the contact with your PD, he will know whether I'm going to take the student or not. And second thing, which Dr. Khillan himself mentioned, when you're giving the interview, look into the eyes of the interview. Don't do this, sir, I did my rotations here and my research was here. Don't do this, sir, I was working over there and I was working over here. Don't do this. It shows lack of interest. You should be absolute sharp focus when you're giving your answers. And as far as my rotation with Brooklyn USK was concerned, I was working with Dr. Siller. So I used to work 4 days a week at 4 different locations. I used to work with the attending physician, I used to work with the nurses, I used to work with the ACT team, I used to work with the psychotherapist. And one most crucial part of my rotation was we used to give home visits to our patients. And the best part of home visit was like it gave me the actual picture of what the patients are going through in the psych field, right? So for example, I saw this lady, she was a 48-year-old, unemployed, trans woman suffering from dissociative identity disorder. And she had 7 personalities inside her. So when I entered the apartment, it was like she was living in the basement. So no doors, like no windows, no sunlight, no curtains, nothing of that sort. It was a complete darkness. So I was with the nursing student, and we entered the room, and like she was just sitting normally, like you sitting normally, right? And she was a 48-year-old, and after 5 minutes, she switched like this, turned into a 7-year-old female, hunched back, crossed legs, close to the shoulders, in a baby voice. And when you see patients like these, you get to know the ground reality of the patients. So when you're coming for the interview, like keep your eyes and keep your ears open, because you never know how life may teach you. Life is a beautiful way of teaching things. And for the interview, even for your research, for your rotations. So yes, I would like to thank you again, Dr. Khillan, for providing with this opportunity. And that's it from you guys. Thank you so much.
So we have guest Mr. Kaushik, helping a lot of our students, helping with the visa. If I mean, he also helped me get a visa for my sister. I mean, she didn't go, by the way. So maybe we will call you again. But thank you so much. He was very responsive, and I like, the way he works. A lot of students, they have all good things to say about you. But he's gonna tell a story about USMLE and his journey also.
Thank you so much. It's a great opportunity. I just called Dr. Mala and Dr. Sumer, and I got to know that Brooklyn was here. So before I give you a little introduction, I want to share a little story with you. So there was this little kid who was born with one less arm. He didn't have a left arm, but he wanted to get into martial arts. So the parents went to the dojo. They introduced him to the sensei. The sensei said, okay, fine, the competition is about a month ago, so let's start practicing. So he started practicing, but the sensei only taught him one move. Once they were little frustrated after 20 days, 25 days at what's happening. Sensei said, just leave it. On the day of the competition, the kid went and he won the competition because the sensei knew the counter was to hold on to the left arm, and he did not have left arm. So the context is that the collaboration between Brooklyn, Dr. Sumer and Dr. Mala is when you choose a good mentor, he can actually turn your weakness into your strength. That's what I realized when I was coming here, that how beautiful this collaboration is. So my name is Sanjay Kaushik. I used to work with the US Embassy for a good 15 years. Then I started my own consulting firm. And I've been helping a lot of medical graduates to crack the visa. The most important thing, what I see now, is that if you all are in a J1 group, what's happening is once you get your visa, you must know how to use the visa correctly. Because a lot of people, they tend to go and stay there for longer durations, because the whole idea is not just to crack the rotation B1 visa interview, but also look at your long-term plans of your J1. Because anyone who stayed there longer, now the visa officers are asking a lot of questions. Even before we go into that, the most important is when you choose your visa category, it has to be a B1. A lot of people may have a B1, B2, but that essentially means that you have a B1, which is for business, a B2 for tourism. Let's say somebody had a visa already, they applied and gotten visa with their parents, and they went to the US saying that they're there as tourists, but they did their rotations there. But once they came back for the J1, the officer had questions. So your responsibility actually starts when you have the visa in hand, right? So let's use the visa correctly. And so let's backtrack a little bit. When you're filling your visa application form called DS 160, so DS stands for Department of State. For the visa officer, the DS forms are the most important document to review. Once you submit your visa form, it stays in the system for 99 years. So whenever you're reapplying, entering the US, or applying for a J1, or applying for a future, the first visa application is always considered. So make sure that when you're filling your visa form, the information on this is absolutely correct, right? So that's one. Once you enter the US, at the port of entry, the immigration officer will ask you questions. Based on that, he'll give you the entry and the length of stay. The length of stay now is becoming very important, because earlier it was fine if a person went and stayed there for 3 months, 4 months, 5 months, because we believe that if the immigration officer has given me a stay of 6 months, I can actually stay there for 6 months. Technically it's right, but because the visa interviews are subjective, visa officer interprets the way he wants to interpret, right? So the interpretation over there is like, why did you stay there for such a long time? What were you doing there? Were you working illegal? How were you supporting for yourself and all of that? It may pinch on the pocket if you go there, stay there for 2 months, 3 months, return back, stay here for a couple more days, maybe a month, and go back. But it is going to actually save your J1. Right? So when you're filling the visa form, make sure that the information is correct. When you go in for your visa interview, carry all the financial papers. Now there's a difference between the availability of funds and the visa law. The law says that students must, or the applicant must, show strong ties to the home country. We've read this online saying that, showing home country ties are very important, but what are those? Social ties, your financial ties, and for a professional, most importantly, your professional goals. So you've got to think about what branch you want to specialize in, and what are the gaps that you've seen in India that you can study there, do your residency, do your fellowship, bring back those values and incorporate those here for your better career growth. You've got to look at your short-term and your long-term plans when you're going in for your B1 visa interview. Because when you go in for your J1, the first note would always be considered. Carry all the financial papers, understand the kind of stream that you actually want to get into. What are the gaps in the industry? What are the skill sets that you want to go and incorporate, right? And then translate that to the visa officer, articulate your answers well. Well, I can go on because it's one of my favorite subjects, but I think I came here to say hello and, to meet everyone. It's a great opportunity, but we'll be here. If you have more questions, we can always discuss those questions. But thank you so much, and thank you so much for offering me this opportunity. Thank you.
Thank you. Thank you so much. I'm going to bring, not yet? Okay. So I'm going to bring Hitesh, and after that we'll do Q&A. So when Hitesh called me, I still remember, Hitesh said, sir, मैच नहीं हुआ मैं और मेरे पैसे खत्म हो गए सारे, अभी रोटेशन के पैसे तो नहीं हैं. तो आई सेड, हितेश तू कहाँ है? कहता मैं क्वींस में हूँ. मैं कहता तू ब्रुकलिन में आ जा, कोई बात नहीं. And since then we are friends, so we did a lot of things. हमारी एक रील बड़ी हिट हुई, हितेश एंड रितेश. So इसका नाम हितेश है, मेरा रातेश. So when he called me, जब इसने मेरे साथ काम किया, I told him one thing. I said, Hitesh, if I put you, and same thing, Anubhav, I'm going to tell you, next year you're going to match, and same thing. I need to put you in front of people because these guys are so good, but like Anubhav is very shy. So iski shyness ab is khatam karni hai. So you have to come to me to do that. So I told him, Hitesh, if I put you in front of a PD, I guarantee he will take you. So he matched in a transitional year. Yeah, a transitional year hota hai, so it's still different than medicine. It's not 3-year contract. I got so happy. I told him one thing. I said, within 2 weeks, you're going to get a categorical contract. Hafte baad hi phone aa gaya iska. Kehta, I got a categorical contract for 3 years. So Hitesh is actually, he also runs a Kinha classes. So a tute bhi karta hai. So lot of things, lot of experience he has. So Hitesh, please.
Thank you so much for the opportunity to talk about USMLE, FMGE, and all my journey. So my name is Hitesh Kinha. I'm from a small town in Haryana named Jajjar. And I graduated from Philippines in 2021. And I followed DAMS like basically from 2020 and 2021. I was the one who was in the Philippines when we launched DAMS there. So I'm like an old student of DAMS as well. And I graduated in 2021, and then I took my FMG exam. I passed in my first time, more than 200 score. And then later on, I started my USMLE journey, passed step 1 in 2022, step 2 in 2022 November. Then my visa got rejected. And I had like no clue what to do next. Dr. Khillan and I was like friend on Instagram, like from last 4 or 5 years. He was following me and we were used to share our post and all. Like we not used to talk, but we used to see each other post and like sometime text, okay. And then I told him my story that my visa got rejected and then what should I do? And then he said, we offer tele-rotations. I'm like, okay, I can do tele-rotations. And then I got to know that the tele-rotations, how tele-rotations work, and they basically started after the COVID happened. And so I got to know about tele-rotations, and then we worked on that. And later on, I did tele-rotation, and I did 3 tele-rotations, 3 letters, because we need 3 letters. And I went unmatched. I got 1 interview, and basically in that interview, I think my interview skills were not good at all at that point, because that was my first attempt, and there was no training available for interview skills. I just like went there like roughly like raw, like I told them like, what's your plan? They asked me like, what's your future plan? I told them with honesty, like after completing my internal medicine residency there, I'm gonna come back to India and I'm gonna open my own hospital. So at that point, that was my goal. Like I never been to USA. I had no idea how they think, how they're gonna judge me about it. But no hospitals want their doctor to go back. Like they trained me for 3 years. They want me to stay there. They want me to work there to serve the population and help US. And I had no clue about that. So that's what interview skills about. And that what at Brooklyn USC we talk about that thing. So later on, my visa got approved for step 3 exam, and then I went for my first rotation in Queens. I went there. The rotation cost is like more than 1,500. I paid for it, and then the goal was to do like at least 6 rotations. And then I like the match before that. The match result came out. I was unmatched. Dr. Khillan texted me like, I heard that you are unmatched. And then we spoke on a phone call, and then he felt sorry. I discussed that, okay, this journey was so expensive. It was a long journey from FMGE to USMLE, and then visa got rejected. And I have no visa, I'm unmatched. What to do next? He motivated me. He said that, like, you can come here, like, you apply again, you can come here, we will get through this. And then at that point, I said that I have spent like most of my money in tele-rotation. Tele-rotations also cost like $1,500. And then the application itself cost like $6,000, $5,000. And then I went to Queens. The New York rent is like $1,500, $2,000. And then I paid for the rotation as well. It's like $1,500, $1,600. And then I told him with honesty, like, I have 2 or 3 free rotations. My plan is to do that, and I want to work with you. I want to be part of Brooklyn USC. I want to work there, but I have no money. Like, I have to pay $1,500. I can do one thing: either I can live rent free there, or I can pay for the rotation. And he's like, "Don't think about that. Just come over." And then I went to see him first time in month of May in 2025. 24. Yeah. And then that's how we met. And then I think I'm the person who created logo for Brooklyn USC. So that was a total journey how I met with the Brooklyn USC people. And then later on I did my like 2.5 month, almost 2.5 month of rotation there at Brooklyn USC. I used to see like 3-4 patients every day. We used to do like extracurricular activities, volunteering work, how to work at communication skills. So at Brooklyn USC, what we do is sometimes we give like chance to someone to sit at the receptionist, to speak with the patients, their family, like update them. Your appointment is tomorrow. So that's how communication skills get better. You get to know like different accents in Brooklyn, in New York, like in different Queens, like they have different accents. And so that part is also there. And then I did like 4 or 5 more rotations in different states. Most of my rotations are in New York and 2 in Illinois, Decatur. And then I matched. I got only 2 interviews. One from Kansas City, it was internal medicine, and then one from TY, transitional year, which I applied like late in month of January to 25, and then I go to interview next month, and then I matched there. And then I'm like, again, with the suspicion, like what to do next. I called him again, like I matched in transitional year and I don't know what to do, and it's not easy to match in transitional year either. The matching rate is like only 4 to 5% in transitional year, because they only give transitional year to US people who are already matched to PGY2 positions, like anesthesia, like they want to do neurology or radiology. So the transitional year are for those people. They are not for those who want to do internal medicine, family medicine. But I got lucky, I got match in like transitional year. And then the next question was what to do next. How should I approach? He told me not to worry about, we will think we have a whole year, we'll make a lot of connections. And he said that I was confident. I was like confident that I'm good at what I'm doing. I used to teach, I used to work out. I have most of things, like we also work on social medias, like we're everywhere. We can impress people. We have that power. We have that power to impress people, and I have that capability which I can show. So first you have to show yourself. You have to sell yourself in USA. It's not like India or any other country, like you are shy. Like I cannot tell them that I work at social media. I cannot tell I have like I taught like that many students in Philippines. I taught that many students in India. It's nothing to, I know it's like bragging in India, but in USA you have to show, because it's not a movie. It's not a movie that someone gonna tell someone that this guy did this. You are the one who gonna tell everything in a good way. In a good way you have to put that. So I matched into transitional year. My first rotation was ICU. And then I was so sure that I have to impress those people so I can match here next year. So that was the goal. And I think I impressed them pretty well. Like how to approach, so it's not just about scores if you are already matched for those students. It's not about score, it's about your communication skills, how friendly you are with the people there. So the Americans, they love like how you communicate, how you talk about their culture, how good you are at everything. Like if you are like, every time you are happy to see patients, you talk about latest research, trials, they love about that, about the open evidence, like new things, about like how things work. You are up to date and you're sharing those things with the faculty. If you are even proving them wrong sometimes, like, okay, you missed these things. Dr. Khillan mentioned a point that he missed few things in a patient and we corrected it. Like, okay, Doc, I think you missed this one and this is how it should be. And he's like, oh yeah, you're right. So those are the challenges. You You don't have to shy there. You can say straight on their face like, okay, I think this is a mistake, we have to correct this. And in my program, like I work with in the IC rotation, and the next rotation was floor. And most of the internal medicine faculty was on the floor rotation. They were my faculty. And then within a 1 week of floor rotation, there was one vacancy open because one of the student was not able to get visa. J1 visa was rejected or something from Nigeria and all. And then they provide the opportunity for every transitional year and also for the orphan residents or the applicants who can have this position. And within like 1 month and the first week of floor rotations, the faculty, they judge everything. In USA, they know everything. The nurses, even the person who clean house, who clean the hospital, they judge everything. Okay, this person is good at this. This person is very friendly. This person is friends with everyone. So they judge these things, and of course about your medical knowledge. And they gave interview. I got an interview, and like within next day I matched. I got an email from the program director. Congratulations, you got the internal medicine position. They shifted me from transitional year to internal medicine, like within 6 weeks. And I never heard of that story that happened because I was lucky. I think someone was not able to get a visa, their position was open, and then they matched. And I encourage you guys to also apply in transitional year as well. If you get a position in transitional year, you have high chance because you will be into the system. The only thing we want you is into the system. You get into the system, and there are a lot of ways to match there. Like you will be friend with the APD, you will be friend with the program director, you will be friend with the faculty. There are a lot of programs. So my transitional year program had like 12 spots. Most of them, all of them matched. All of them matched next year. Like 6 of them were already pre-matched in different positions, and the other one were taken by my program. 2 in family medicine, 2 in internal medicine. So the only thing I would like to say is try your best to get into the system. Okay, and that's how Brooklyn USA is helping. We have a whole network. We have like doctors in every hospital. We have friends in every hospital, so we can suggest your applications. We can tell them, okay, so this is our friend, he worked here, he's really good. And we can suggest to the program director or coordinator, okay, this is the friend, and we have this application, and they will review it. And that's how things work. So first, do your, like, if you need help in step 1, step 2, we are opening a program where we will talk about step 1, step 2 exam. And if you need help in getting USCs, we are also there. If you need helping in staying in USA, we are also helping in there. And if you need help in applications, we are also there. We're going to do application, how many programs, where to apply, because that's also important, because that's going to cost you like $5,000. Why do you apply to those programs who are not going to take you? It's like a waste of money. So we will help you to judge which program to apply. And I think you asked a question about the community program and about the university program. I'm in a community program. So what's the pros and cons? Mainly when we talk about future, let's imagine you are in a community program, you are in a suburban area, and you want to think about your future. Where will you go? Because if you are on a J1 visa, you have to come back to your home country for do the waiver. You cannot do waiver in the urban countries. You cannot do waiver in the New York City. So the mostly community programs are in suburban areas, and the advantage is most of them you can do their waiver. You can do your waiver there. Like my hospital provider, it's in the waiver area. Like if I want to do a job as a hospitalist, I can just stay there. I can finish my waiver, and then I can go into big cities. So that's the big advantage if you look about future. And also the matching rate. My program, like the residents got match in fellowship programs. So it doesn't, if you are good at it, if you are good at like, your residency, if you are good at your IT score is good, you're doing great, you will match. Okay, but our first thing is you have to get into the system. Okay, so we are helping with the applications. Later on, we are helping with the interview skills. Okay, and what program likes about you? Like if they're going to ask you some questions, it's like a simple introduction, or it can be like hard questions, or it can be about medical knowledge, or it can be about your hobbies. we can tell like what you can say. Like the mistake I made, they asked me about what's your future plan. I told them, okay, my plan is to come back to India. That's what you tell to the interview, the visa interview. That's the question for the visa interview. The answer was for the visa interview, like I'm gonna come back. I'm gonna finish my residency, I'm gonna come back. Not for the hospital. For the hospital, you have to say, my future plan is to work here, to serve the community. So we have to like discuss about those interview skills, like what to answer, how to answer, and where to answer these things. And Brooklyn USC will also help there. So that was it.
He's ready? Okay. So we have one, so finally we, one of the person woke up from US. It's really early. So Gushan is also one of our students. She is PGY1. So we're gonna put, yeah, he's ready. Yeah, Gushan, you can hear us? So we're almost done. I have 3-4 more slides and then I will answer all the questions, okay? How you will communicate with them? I think she's there, right? Okay. She can start actually. You can see her.
You can start.
Am I audible now?
Yeah.
Okay. Hi guys, I'm Gulsharan Kaur. I'm the internal medicine resident, first year incoming PGY2. I have been invited here to talk about my experience as an international medical graduate and share some practical insights with you. So I'm like not very average student, not a very excellent student, but yes, I did have the vision that I do want to go to US, pursue my MD from there. So I took all the steps which were needed to be done. But the honest truth is, like, for me, I did not have any guidance, nor in my family, nor anyone I knew that who could actually guide me. So I moved to New York, where I had my step 3 done, and then I started looking for my rotations in internal medicine. So I have done a lot of rotations. Like for 2 years, I just did rotations and research before I matched. And I matched in my second cycle. In fact, I could not match in my first cycle. There were some lags in my application. And then also, I had no experience that what to say in interviews, how to answer questions in interviews. Those are very important. So I have done observerships at clinics, even like at such basic clinics like urgent care also. And I have done rotations in very big hospitals like Mount Sinai, Morningside, which is like one of the biggest hospitals in New York City. One thing I would like to tell you that when I was giving my interview in match cycle, no one asked me this, that where did you rotate it? They asked me questions related to my letter of recommendation, what was written in my letter of recommendation. So I think like when I worked in clinic levels, I was more engaging and I was able to connect with my attending. And they knew me, like my clinical skills. We were working one-on-one. At the hospitals, there were so many observers. There are residents as well. So I think that personalized experience, which I was able to receive for me, was at the clinics. And that's why my letter of recommendation from the clinics was more personalized. I remember at one of my interviews, so they specifically mentioned that, oh wow, Dr. Khillan has written commendable letter of recommendation for you. How was your experience there? And then also my research were mostly from Dr. Khillan's clinic. my first cycle, I went unmatched because I did not had any US based research. I did had research from my medical school, but when you are applying here, they want you to look into the researches which you have done in the US itself. So thanks to Dr. Khillan that he gave me that opportunity that I could get engaged into the research experience there. He see one of the highest patients of like cancer, especially multiple myeloma in Brooklyn. So the EMR system is your, sorry, that's my so your EMR system is the biggest, I think, gift at his clinic, and he gives you full access to that. So I utilized that opportunity to the fullest, and I did like published and so many papers at his clinic, and that is the only thing which actually changed from my first cycle to from my second cycle. And definitely when I applied second time, I was asked about questions on my research, on my publications, on my poster presentations, and everything was done at his clinic. So this is, I think, the when most of the students which approach me now, even on social media, they ask me, oh, we are not able to get into observerships at the hospital. They have like 6-7 months waiting. They're charging you. And many of the one of my friend, a very good friend of mine, he didn't even receive letter of recommendation from one of the hospital he did rotation in Florida. So I think that the most important thing is like how well you are able to make yourself rememberable by the attending you are working with. And for me, I think that personal experience, I was able to get into the clinic because you're one-to-one. The student and attending ratio is not that much, and then you are engaging into so much of conversations with your attending. So that kind of helped me. And the research perspective, I would say, at Dr. Khillan's clinic, I not only did the research, but we also got used to like get engaged into volunteer work. So it was observerships, volunteer work, research, and I was mentoring students because I was there for a very long period of time. So I was mentoring students, so I was doing mentorships as well. So I think it was overall a great and wholesome experience for me there. Yes, and then when I applied second time, I did match. I was asked questions on my letter of recommendations, my research, and my PD. In fact, where I matched right now, he called me before they make the rank order list that he really wants me in the program. And yes, that's my journey. Like in brief, there has been like a lot of struggles, up and downs in these 2 years, but this is just a short, wholesome experience I would like to share with you guys because this is the most most like common question I do get. Like, how does it matter if we do hospital rotations or clinic rotations? It does not matter, guys. The letter of recommendation, what's written in the LOR, it matters. And where did that LOR came from? That also did not matter. Of course, you're gonna get your LOR from an MD doctor, but what's written in the LOR, that matters. And how is your performance there with the doctor? They're gonna see that. And everyone, they do read the letter of recommendation, so those are very, very important. And I'm happy to take any questions if you guys have any questions for me.
So Gurshan, we're gonna do questions after this. Thank you so much. I know she has to go to work also, and it's really, really early. So we can, I think, Vansh, yeah.
I'm not able to hear anything.
I know. Yeah. Hello, thank you so much. So I want this. I want now this computer over there. Yeah. Just few more slides, guys. We're done. We're done. This one not working. Oh, it will. So I get okay. Wait. This one will work. Okay, we can. You guys can see over there. That's right. So this is just I get a lot of actually text messages when people don't match. So they text me. They have done all the inpatient stuff, and then they text me I didn't match. So I just bring one. There's no information about who the person is. So like look at the application. The guy spent $65,000 on the rotations. He did like, and look at the scores. Year of graduation, you want like good, right? 2025. 263 score in step 2. He did 6 months transitional research. He did publications. He went to Cornell, did like 6 month plus rotations. Cornell University, NYP, Advent Health, UCFS, WashU, like whoever gave him chance, he went there. But he could not match. And not because he did not get interviewed, 10 interviews did not match. So I have like so many texts like that. So this is like one of them. So it's not guaranteed if you go to hospital you will match. So again, it's the information, how you present yourself. Sometimes you have good score, you have all this, then you become a little arrogant during the interview. So there are a lot of factors which matters. So that was one I thought I should show you guys. But I need this for the results because that is the most important slide for me, and I feel very proud. From last 3 years, we are matching more than 100 students. And this year, I'm scared also. I'm like, oh my God, what's going to happen with the visa and all that? And when my WhatsApp, like that day, we get so many messages, our WhatsApp got blocked. They blocked our WhatsApp. So many messages. Everyone attacks me. I match. Like, these are all people who need visa. And I'm like, and I had some with the green cards also. Of course, I knew they're going to match. But I was very, like, a little worried about the visa people. Everyone matched. This year, I think, was even better than last year. So, we can get it there. In the meantime, so this is the work these guys do, research. So some of the posters, these are on our website also, you guys can see. And for myeloma, actually, they got their poster accepted in international conference, myeloma conference in Brazil. It was so amazing. And then this is, I think, when they were in the actually real meeting, Soho meeting. So Gushan is here, Sahar, Akhilesh, Rida, they all matched. Now, one of them was actually a resident working with them. So this is Akhilesh, he was presenting his poster. So it's his video. Good. So then, we also always laugh about USMLE step 4. So that is also not a bad option. If you can get a green card by marrying somebody there. So why not, right? So I always call it step 4. If none of the other things work, so that is an option. I always feel arranged marriage is not bad, not always bad. And love marriage is not always good. So if life sometimes takes you in certain direction, God has always good things for us. But he doesn't tell us that. Because I think it's so challenging. If he tells us, like, how if he would have told Jaskaran, Hitesh that this is what they have to, go through, Anubhav, they will never start it. They said, no, we will not do it. Like, it's so hard. That's why he doesn't tell. Because we are very resilient as a human race. Look what we did, right? So that's why. I think, but if you work hard, it does. Okay, so so this will not work, right? Nikhil, this one will not work? Yes, so I have to do it there. So I have this video we always make, 2024, 2025. 26 is just match came like last week. You guys can see my Instagram is full with people who match. So the person who please there, Nikhil, you come here too. I want to. So Nikhil is our editor. So he does our media and everything. And everybody tells me he make amazing videos. So guys, this is the guy who do this for me. So so this is the 2024 and video with how will it work? Video. Oh, just enter, I think. No. No, this one. 2024. This is 24, now 25. All right. So that was the match. So just the message, like as we did with the rotation. So we'll try our best with the steps also. And again, I will tell everyone in India, apply more. I'm telling you, it's worth it, guys. And there is a lot of need. And I think we can get more. Don't get scared. Whoever tells you, oh, it's not possible, do this and that, don't listen to them. Delete them or block them, okay? No negative people in your life if you want to do that. So I have few questions which will quickly I answer from here. And then if you guys have, I will be here for some time if you guys have any questions, personal questions, So the first one was, it's important, that's why I'm like, some of the questions are very important. This is the first one. Is there any way to earn as a doctor while staying in US before the match? So guys, don't even think about it. Don't try it. Do not try on any B1, B2 visa to make money in US. If they will find out, right, Mr. Kashi? You are done. You will not get J1. Absolutely not. If you have green card, that's different. Then you are allowed, if you are allowed to work there, only then, okay? Then do you have to explain gaps in personal statement or somewhere else? I will not do it that in personal statement. Tell, otherwise no need, right? Then elective, like 4-week elective in medicine, 4-week in surgery. You unable to decide whether to go. Yeah, that's a good question. As a student, sometimes you guys are very young and you have not decided what you want to do. So it's not a bad idea to do both and then see which one you like, right? Yeah. Next question is, I need to ask for embassy approval if I already have a valid B1, B2 or invitation letter to enter the second time. Do I need another invitation letter? Okay, so better to have the letter. Thank you, Mr. Kash. Then next time is, does coming from a medical school with conflict with US like Iran negatively impact your chances? So just don't write on your Instagram, death to America. I think then it will. Otherwise, I think we have a lot of people from Iran and we love them and we take them. I think it should not. Yeah, as long as you are not very, like now social media, they look. They look into social media. You have to keep it open. So there should not be anything in your social media too violent or things like that. Like common sense. It's a common sense question. Do you sponsor visa? No, I don't have. We don't have to sponsor visa. We will give you an invitation letter and you get the visa from the embassy. It's a visitor visa you need to do rotations. You don't need any other visa. B1, B2, you can do rotations. What is the best time for applying for rotations? Can one apply before step 1? Yeah, you can apply before step 1. And again, as I said, there's no set time. It depends how serious you are. If you're very serious as a medical student, you know that this is what you want to do, then I think 3rd and 4th year, start preparing and visit to US also. Will it be a positive note if I add I'm a USMLE step tutor to my CV? As Hitesh said, any extra thing you do than medicine, tell them, because nobody else will. So you have to. I have done with step 1 FMGE. How many rotations can one? So we have rotations as I showed. So most of our students who match, they do 3 with us. because that's the requirement. They get the 3 letters and then they match. Where to begin research work, fresh graduate, but still. So one thing we are doing with the research is, before, what we used to do, students come to us, then they start research, and then I have seen that sometimes they were not able to finish the research. So what we did now from last year, we are giving students option to start research before even they come to us. Like, you know, the Dubai, people from Dubai, so I have like 7 students from Dubai. So they came to me in July, but they start working on research from January. So by July, when they came, they already have like papers already presented, published. So that helped. So what you need to do is contact the team, tell them I need a rotation, but I want to do research. If you pay the deposit for the rotation, you can start the research online with us. Because a lot of things in research you can do online. There's no issue. And when you come, suppose you do it here now, and like AMA is coming in May. So you put a abstract in AMA, it got accepted to present. Most of their meetings, they are in Disneyland. So when you come in July, go visit Disneyland and you can present, and a lot of people come there. So as networking, we said, right? So a lot of program directors will be there, APDs will be there, ACP conferences. You go present and you may get some numbers, you know. People are very friendly, by the way, in America. They will give you their cards, you send them email, they will answer. Then they will. But cold email problem is now there's a lot of junk email comes in the email. So there's a lot of filters, a lot of the email, get filtered. So that is from my end. I think I can go on for 2 more hours, but I think this is the basics which we have. And after this, if you guys have specific questions about so you're welcome to talk to me. And as I said, we are here to help. And I want to see more people from India match in next 5 years, Dr. Samir. Let's do it. All right, let's do it. You guys have any questions?
Yeah, good afternoon, Dr. Khillan. So, what are some ways to compensate a year of graduation more than 5 years in your application?
I told you, right? 285 programs don't care how old graduate you are.
Okay.
Good scores compensate for everything.
Okay.
Everything. You have good score, you didn't fail anything, you did research, your application is good, and your application is made very good, very professional. Work on your accent, work on the way you talk to them. That's it. Nothing else. Nothing special. But everything should be perfect.
Okay, so, I've heard a rumor. So that's like when the PDs go through the applications,
right,
do they apply a filter or something to directly the beginning stage to filter out more than?
So you want to tell me secret, okay? So it's not humanely possible for any program director to go through thousands of applications. Yeah. Not possible, right? So what now we do is, and I don't want to go to signals because that's like 1 hour lecture. Yeah. So there's something called signals now. Cool. So what they do now, there is 3 gold signals and 12 silver signals. So what PDs are doing, most of them, they are only picking up applications from that gold and silver signals. Like there are 6,000 applications, maybe 1,000 people send them signals. So they're gonna not even look at those 5,000 applications, and they're gonna look at the 1,000 applications. So now they have a little bit more time to review it, but still they have to put filter. So this is how they do it. So they put first round and different rounds. First round, they like, give me students with 250 plus scores, right? Give me no failure, give me only J1. So these 3-4 filters, right? And EC FMGE certification, of course. Everybody put that. So he got 100 applications or 50 applications. He sent interviews to them, but he's like, no, I need more. Then he will do 245. Next round he will do 240. So it keeps coming down. And also a recommendation, like Hitesh said. Some program they give 1. Most program give 1. Like as a resident, you can recommend 1 person. Some do 2, some do 3. So then they, listen to them. Okay, I have somebody to recommend, and they give you. And sometimes, if you know somebody really well, like I have sometimes students come, they have like, a little bit issue in their application. They failed a step or so. So sometimes I call the directors myself. I'm like, the student is very good. I don't know why he failed. And I think we should give another chance. And they listen. So this is how it works. So yes, there are filters.
Okay. Thank you so much.
You're welcome.
I have a question to Mr. Kaushik. So, if we are going on a B1, B2 visa, if our intended duration of stay is, let's say, 30 days, is there any provision to extend it if we have to stay there for another month or so?
So one is, I assume that when you fill your DS 160, over there you did mention you'll be there for 1 month, right? For the visa application form, but when you are actually traveling to the US, at the port of entry, the immigration officer will ask you your purpose of visit and the duration of stay. Largely, they'll give you six months of stay. But my suggestion and recommendation, like I said also in the beginning, do not extend your stay beyond 2 months. You know, I mean, you can actually stay there, even if you've mentioned 30 days on your DS 160. But at the port of entry, they'll give you 6 months. So you are eligible to stay there for 6 months. But please don't stay there for more than 2.5 months.
From my understanding, the TSA asks you for the like duration you're intending to stay. And is there some form or some procedure we have to follow if we need to extend our stay for another 1 month?
Okay, so once you are entering at the port of entry, the immigration officer would by default generate a form called I-94. That I-94 shows the duration of your stay, which is 6 months, right? So you're eligible to stay there for 6 months. If you're deciding to stay there for beyond 6 months, then you have to apply for an extension. There is a procedure, but then your J1 really gets jeopardized. Don't do that ever.
Yeah, not 1 month. Like if it's 1 month and I want to stay for 1 more month.
That's not an issue at all.
So actually, my visa interview is coming like next week. April 8th is my B1, B2 visa interview.
Great.
And I've actually booked a rotation with Dr. Khillan.
Wonderful.
Yeah. Yeah. Okay, yeah.
I want to talk to Dr. Khillan. I'm like, why is the call from Homeland? I'm Inspector, Jose. I have these two students. They said they want to work with you. So I just hold on. So I want to get my record. I said, give me the name. So they go through California.
Right? So they're going to do rotation with me, but they landed in California, and they were sitting there like they were being interrogated. They're like, why are you here? So I said, let me first check the names. And yes, brother and sister, both of them did everything. I said, yes, they are doing rotation with me. So what they said, so their rotation says 4 weeks, right? Because you guys do 4-week rotation. So officer asked them, first California got a little suspicious, like you're doing rotation in New York and you landed in California. Second, they said, how many months you want to stay? She said, 3 months. He said, but your rotation is only for 4 weeks. What are you going to do for 3 months? So anyone who says more, ask for more, they always give 20. They gave them visa for 28 days. That also I told them, I said, they are not terrorists, they're doctors, please let them come. So they let them come, but it was a problem. And they got 29 days visa. They didn't give them more than that. So, but everyone else who said 4 weeks, get 6 months. Yeah, got it. No problem at all.
Thank you.
Be honest, honest over there. Don't make up stuff at all. They will ask you, like, student come, oh, Dr. Khillan work in Mount Sinai, this and that. I'm asking you, you're going to work in his clinic. They know me very well. Almost 600-700 students go every year. Under Brooklyn, USK, we have a different doctor. They know. Student go there, like, they ask you, you're doing USMLE? No, I'm not doing. I'm just going to see how system works. They know you have done USMLE. They know you have done USMLE. Say that, yes, USMLE. Because they know what I do. Website is open in front of you. Right? It's written there that we provide clinical rotation to you guys to help you match. So tell them it's all right. Yeah, be honest.
Thank you. Thank you.
For the visa interview, we'll sit down for a while and I'll tell you.
Afterwards, you can.
Please, definitely. Thank you.
Yeah. Sure.
So, might be a personal question, but like I am going to the US to do rotations with Dr. Khillan for 3 months, right? And I also have my step 3 exams, but I haven't taken the exact date. I have just taken the months, and like I would be going for like 5 months. Because first port of entry would be California because I am going for the ACP conference. And after that, for 1 month, I am not doing anything because I might give my step 3 exam, and then I have all my rotations lined up. So like I'm confused. Like how should I present that to visa officer, and is it like correct, or like I have all my return tickets, everything booked? but like still my visa is expiring like after 1 month. Like I am coming back in September, and like my visa is expiring in November. So like.
So your question is, you already have a B1,
yeah,
B2?
but like it's expiring 1 month after I come
once
back.
you return back. Okay.
Yes.
So your question is in two parts. One, once I enter the US, if I have to stay there for 5 months, should I stay there for 5 months? Because
so
a lot of things.
So basically, no. Like I probably, because I have scheduled my rotations at the end.
He has to stay there for 5 months.
Yes.
He has to.
Yes.
Because he has.
So because my
ACP
conference was, I
yeah.
didn't expect that to come, but like it came, so I have to like attend that also, and like the rotations I didn't, like I planned for near the match thing.
Okay. So I understand your question.
But
so
I can't come back.
You have to stay there for 5 months.
Yeah.
You have to.
And my visa is also getting like
right
at the end.
Right. So when do I, in fact, apply for my renewal of my visa?
Like,
right?
is it safe to stay there for 5 months, or like?
Well, I mean, push come to shove, if you are, staying there,
is it legal?
Yeah, it is. Like I said, you will get a stay largely for 6 months, provided the immigration officer at the port of entry does not limit your stay. So make sure that, he's not limiting it. If he's limiting, then, so there's a difference between the visa and stay. So the visa only allows you to travel till the port of entry, right? The immigration officer gives you the stay. If anyone extends the stay without an extension, then that 1 day is illegal of stay in the US, which prohibits you to re-enter the US for next 3 years.
Okay.
So first is when you enter, see what's your I-94, what duration they have given you, comply to that. So that's one. If there's a possibility of returning back and going back, you should do that. If not, then your stay over there, make sure that you're keeping all your records in place. How are you taking care of your expenses? If you're spending through your credit cards, make sure that you're accounting everything, because that's one of the major concerns for the immigration, for the visa officer when you go back for your renewal, that how are you supporting yourself?
Okay.
If you are booking your hotels or Airbnb or whatever, keep records.
Okay.
And also keep records at what all you did there. Make sure that your documents are absolutely in place. So that's one. Once you return back, your renewal. So when is your next trip that you're planning?
Like that's the match cycle. So I don't know if I
right.
get
offline. So once you return back, do not apply for your visa renewal immediately.
Okay.
Don't. That's a red flag for the visa officer.
Okay.
Wait for another 4 or 5 months and then reapply.
He will apply for J1 after that.
That is even better. That is better.
Yeah.
So my question was like, suppose I get like an offline interview, as Dr. Hitesh said. So like, that then I am stuck. Like I had to like let my visa expire and then apply again.
So renewal usually does not take start till end for within 30 days you'll get your renewal done. The visa dates are available for renewals.
Okay.
So that's not an issue. Okay. It'll be a Dropbox initially, but Dropbox. Yeah. So Dropbox usually means that you submit your application at the VFS office. It goes to the visa officer. The visa officer then review your case and decides either to issue a visa to you or call you for an interview. Okay. If they call you for an interview, it's an open date. You can you can appear for the interview any working day. So it's not that you have to struggle for a visa appointment.
I think one more thing, Mr. Kaushik, he want to ask you is, so he has visa for 6 months, no issues. So what he's asking is, he's coming to me to do 3 rotations. He has proof for that. But my rotation will start a month after he enters, because he has to attend an ACP meeting. And he has proof for that too. And then he has to take step 3, which he don't have date. So 3 things happening. What I think is, you have to explain like you explain here. So why I'm going for ACP? Because my poster got accepted. Here's the proof. Then I'm going to do rotation. Here's the proof of that. 3 rotations. This is my housing. And I think they will not bother you, especially you. I think they will give you for 6 months. But you need to explain that. Yeah. Yeah.
Yes.
Right.
Yes. Okay. And if you will take like more time, they might take you for second inspection. They will take you like further. They're gonna discuss for like 1 hour or 2 hours. So they're gonna ask everything. So if they will take you for second inspection, probably they're gonna give you the visa, or you're gonna stay there. But they might take you for like a second inspection. That's common, especially in California. Make everything clear.
What you will do after, then he may not ask you that you will do what. So if they, I have a student come to me, they didn't ask him a single thing. I just, when next time. They didn't ask you anything. He didn't have any letter or anything. Yeah. So it's all, the more confusion you create, the like as Dr. Srinivas said, she couldn't understand what you mean. So it was not clear. So tell them ACP, then they will ask you, mostly they give 6 months. Only time they give you 28 days if they get suspicious. Okay. So
because like I haven't taken the exact step 3 day, only
right.
the month. Like the thing I probably
60-70% they will not even ask you how long. They will not. They will give you. Right. If they ask you, then explain. Then I have 3 rotations also, and here's the proof of that. That's it. With proof.
Yeah.
Proof. Yeah. Very important. Documentation. That's what they plan.
Thank you.
Right. So and also make sure that the finances. Yeah. You know, if you're carrying credit cards, if you're carrying your travel cards, make sure that it's loaded. Because they want to understand how will you support yourself.
Right.
So be very clear. Make them understand what's your purpose. But like Dr. Khillan said, usually they don't ask. They like what is the purpose of visit? Yeah. They'll ask you that and maybe out. That's it. Okay. Yeah. Okay. Nice. Thanks.
Dr. Khillan, is there any LOR limit or how much recent LOR should be submitted in a match cycle?
How much advance?
How much recent LOR should be submitted? Recent? How recent?
How recent? Oh yeah. Recent. How recent? Yeah. So this question, everyone asked me this question. So I will tell you what US students do. What do you guys think? US students also need letters, right? So you think they will get letter like current letters? It's not possible because some of the rotations they do in first year, some they do in second year, some they third year. So who you get letter from? From the doctor who like you, because they work in all American doctors, right? And they want the best one. So they pick people. So if they have done a rotation in first year and they ask that person to get the letter, that's 4-year-old letter, right? It still works. So it doesn't matter at all. As long as it's uploaded 2 years, within 2 years, your one letter you can use 2 times, right? Like if I give you a letter this year, you can use this year, and without asking me, you can use that letter next year also. But if you need again, then you have to tell me again to upload it. Yeah, but letter is valid, no issue. And I hope you don't have to wait that much.
Yes, sir, sure. And sir, is there any racism regarding IMG's doctors in US?
Racism? Yes. I didn't see any. Yeah, they were all. I saw racism from Indian people only.
Okay. And so one question regarding transitional year. I heard like if we match into transitional year, there is difficulty in matching PGY 1 year because the limiting body, the regulating body decided but limited fund for 3 years.
No, that you are confused on that. Yeah, let me answer him. Then you. Transitional year is different than prelim year. So J1 visa, the clause J1 visa says by law, if you go from 1 year, you have to go second year. You cannot do prelim internal medicine 1 year, then start your internal medicine residency from PGY 1. You cannot do 2 PGY 1s. You have to do PGY 2, PGY 3, or you have to do different specialty. So if you do prelim 1 year medicine, you cannot do prelim 1 year PGY 1. You have to do surgery or something else. But they don't consider transitional medicine as medicine. It's considered as a different specialty. So after transitional year, you can do medicine. But prelim medicine becomes challenging sometimes. That's why. But good thing is, after prelim, most of the programs actually help their student get PGY 2 position. Yeah,
for their reputation of program. For their reputation of program.
Yeah, they don't want like a lot of people going unmatched. Yeah.
And so, regarding hard filter, does all program apply YOG as a first filter of their choice, or there is it is
I don't. Should I show you guys the database they guys made? So that will answer the question, right? Here, let me. So this is the database which we made. Now, just to see like how extensive is it? Can you see? Oh, it's not visible. Can we? तेरे ही है ना पहले ईयर ऑफ ग्रेजुएशन की काफी वो क्वेश्चन है आप लोगों को, इसलिए मैं बताना चाहता हूँ एग्जैक्टली आई वांट टू शो यू गाइस इफ यू कैन ब्रिंग इट. यहाँ से दिख रहा है, यू गाइस कैन सी इट राइट, और यू गाइस कैन गो देयर, इट्स ओके. या आ गया. some movement there. Something is happening. Screen share, I have to tell. Like this screen I can share there. नहीं ये this share है नहीं तो what we will do is मैं ऐसे करता हूँ एक मिनट I will show you on the laptop actually. Cannot do it that time. I can show them. That's okay. You guys can see it, right? Okay. So look at this. So this is important. So this every internal medicine course. We have one for nursing, family medicine, and psychiatry. So look at this. So this is the name of the program, right? Then this is a number, ECG number. Then this is the city. This is program accreditation status. Say is it accredited or not? And after that, it has like, do they participate in math or not? And then you're gonna go. Then they like, what kind of visa they get? J1, H1, right? Important, right? And then after that, oh. After that, how many spots they have, right? Position. Is it categorical? It is prelim. And after that, how many of those students in last 3 years they took US IMGs, non-US IMGs, DO, MD graduates? Exactly, like this program took 88%. That is this program, 88% non-US IMGs. Very clear. After that, what you want to know is what is the year of graduation? No set cutoff, right? And then go down, less than equal to 5 years. So it is there. Information is there about year of graduation. So filter, this is the these are the filters actually. This is real-time data. So you will know what are the programs which absolutely tell you don't apply to us if you are more than 3 years. So there's no guesswork anymore. So it's there. After this, must or preferred. Must means they will not even look at your application. Preferred means they prefer 3 years, but they may look somebody who's extraordinary even if 4 years, right? After that, their website. Then this is the score I'm talking about. What is the score they used to give interview? 225 to 263. See? Everything is there. Everything is there. Then how many people they give interview percentage wise? How many of them were non-US IMGs? How many were US is here? Then signals. How many people they invited from signals? How many people sent them gold signals? And out of that, how many they invited? We know that. We use that with our students when we apply. They use this system. And that's why they got it. Because they are telling you these things. So we need to use that technology, right? Silver. After this, how many? So match students. What was the score? That is available also, right? After that, interview invitation, depending on your step score, right? After that, I will tell you how detailed this thing is. Even geographic preference is there. After that, what is the race of the students? Are they Indian? Are they African? Are they US? Are they boys? Are they girls? Everything is. So this actually worked very well because we use that map to tell our student, like just current application we look into, and what was his scores, and we applied. Subhav got 9 interviews just based on this mathematics.
Dr. Khillan, 2 more questions.
Yeah.
One is regarding my senior. She is graduated in 2014 and she has done MD physiology from India and SRship and 1 year of assistant professor. So is there any chances of getting match in family medicine? And she has got H4 visa also.
Oh, she's there now?
Yes, H4 visa.
H4 comes with EAD, right?
I don't.
But I think she still need visa.
So she wants to know, will J1 will...
She cannot work. She need a separate one, right? Yeah.
So she will need J1, right?
Yeah. Whatever she can
J1
work.
or H1.
Most likely J1, yeah.
And one is out of context, like...
No.
Is the...
Is she done steps and stuff or no?
Yes, step 1 cleared.
Oh, okay. So again, as I said, as you asked me, if she scores good, she is there, she should work with people over there, she should be in touch with the system.
Yes, she is in touch with many.
Yeah, keep doing rotations, keep doing work. Like show them that, you know, although it's long time, but still you are connected to medical field. You did not give up on that and all that. Yeah. And she's gonna need a little more. So she's gonna need somebody to show her application to the PD.
Yeah, she has more connections.
Yeah, that's it.
And
But possible.
Does J1 visa allows moonlighting from second year onwards?
So yeah, so J1 visa, so that's little, answer is yes. Answer is yes, but it all depends on the institutions. Some institutes don't let you do moonlight. Even on like green card, they don't. But some of them they do. Most of them do because they need people. They are always short. Somebody gets sick or 2 people get sick, so somebody has to cover. So yeah, but that is minor thing, don't worry about it.
Okay.
What did I tell you? 15 years from now, you're going to have so much money, you will not know what to do with it. Okay. So don't worry about money.
Okay. Right? Thank you so much.
Good? All right. Let's eat something. All right.
Yeah, so thank you so much, Dr. Khillan and also Dr. Sethi for this wonderful opportunity to all the IMGs. And anyone who has any more questions, we are here, right here at DAM's Green Park office. I'm always here. And we'll be connected with Dr. Khillan for anything that you need to know. Okay? Thank you. Thank you, Dr. Khillan, again, and your team.